Good morning, everyone. Welcome to Council Chamber for today's council meeting. It's January the 24th, 2017, our first council meeting of 2017. So Happy New Year to everyone. And we will be having lots of Happy New Year action this morning as the Chinese New Year, the Lunar New Year is upon us in just a few days as well. But I'll say a welcome and I'll ask our clerks, city clerks, for the roll call, please.
Mayor Robertson, in the chair, Councillor Louis is on sick leave. Councillor Stevenson, Councillor Deal, Councillor Jang, Councillor Reimer, Councillor Meigs is on sick leave. Councillor Ball, Councillor Carr, Councillor Affleck, and Councillor DeGenova is absent from the chamber. Mr. Mayor, you have a quorum.
Thank you very much, Madam Clerk. And first of all, we will acknowledge we're on the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and thankful for that. We begin this morning, sadly, with some condolences. Three people, it's been some time since we last met in December, and over the holidays, we lost three great Vancouverites that we are going to acknowledge here today to kick off this meeting. And first, I want to acknowledge with great sadness the passing of Joe Way. And Joe had a very big impact on our city in Vancouver here with his achievements both as an architect and as a community activist. And as an architect, he's responsible for much of the iconic architecture in Chinatown, from the Sun Yat-sen Classical Garden to the Chinese Cultural Center, Museum and Archives, to the Millennium Gate on Pender Street, three iconic pieces of architecture and many others through the city. Joe had an amazing knowledge of the history of Chinese Canadians, and particularly here in Vancouver, the significance of our Chinatown. He fought very hard, successfully campaigned with many of the community leaders here to have Chinatown designated as a National Historic Site a few years ago. Great achievement of our community. And in addition to being an award-winning architect, Joe was also a very passionate community activist who will be remembered for his work on the heritage conservation in Strathcona, Chinatown, his work as well developing inclusive neighborhoods here in Vancouver, his advocacy in Strathcona to protect public housing and to successfully stop the construction of a freeway into downtown Vancouver. He was a big part of that movement decades ago, with many in the community as well, that really changed the shape of our city at that time, right to this day and going forward. Joe will be remembered for his many contributions to Vancouver, including his culturally significant work as an architect and also his generous spirit in being an advocate for building strong and loving communities. Joe will be missed by all of us here in Vancouver, but his achievements will continue to be seen and felt throughout the city and neighborhoods through the city. All of Joe's life's work will remain visible, prominent, and a symbol of his great contributions to Vancouver. So we remember Joe, and we also acknowledge the passing of Joy Coghill. She also passed over in recent weeks with a career here spanning over 7 decades. Joy was a performing arts legend. She graduated from UBC in 1949 and then from the Art Institute of Chicago in 1951 with an MFA. She co-founded the Holiday Theatre, which was the first professional theater troupe for children and the first professional theater troupe for seniors. That's the Western Gold Theater Company. So she established several companies. She was the first female artistic director of the Vancouver Playhouse. And from 1970 to 1973, she was the head of the English section of the National Theatre School of Canada. In 1994, Joy founded Western Gold, which is a company for older actors in Vancouver, for which she devised the Alzheimer Project, way ahead of its time. She played a very key role in the creation of the Performing Arts Lodge, that's PAL Vancouver, in Cole Harbour, a social housing and theatre project, a place where many great artists live now and continue their careers. in their golden years. And over the course of her career, Joy won 4 Jessie Awards. She had honorary degrees from SFU and UBC. She had the Order of Canada. She was bestowed that, the Governor General's Performing Arts Award for Lifetime Achievement, and the City of Vancouver's Mayor's Performing Arts Award for Lifetime Achievement as well. A very storied career, and again, contribution to our city. We definitely extend our deepest sympathies to Joy's family, and thank Joy and her family for the great contributions and her passionate advocacy for arts and culture in Vancouver, and ideals that will always inspire us. Finally, we remember Michael Lanier. Michael, on January 12th, passed away. He was a longtime CUPE member, an activist, a member of the City of Vancouver's Joint Child Care Council. He became a CUPE member 20 years ago by organizing his workplace, which supported people with autism. And he will be missed greatly by his colleagues, brothers and sisters at Local 1936. Michael went on to represent Metro Vancouver as the Regional Vice President for CUPE-BC for more than a decade. He was the co-chair of CUPE's National Child Care Working Group and served on the CUPE-BC Community Social Services Committee and the Child Care Working Group. Michael's commitment to issues around child care also extended to his work here at the City of Vancouver's Joint Child Care Council, what we call the JCC, who've been very active in recent years. Michael joined the JCC, the Joint Child Care Council, here in 2012. Never missed a meeting, was a very strong advocate for a public, nonprofit, and national child care program, as well as improved working conditions and wages for all child care workers. Michael was a passionate New Democrat, believed very strongly in the importance of working together with progressive movements to achieve policy goals. And his contribution to the City of Vancouver and on childcare in particular was greatly appreciated. His presence at the Joint Child Care Council and in the community will be missed. On behalf of the City of Vancouver and all of Council, I'll send our sincere condolences to Michael's wife, Kathleen, their daughter, Deanna, and her partner, Pablo. So we remember Michael and Joy and Joe, 3 great community leaders who we've lost over the recent weeks at this time, and thanks to all who celebrate their great lives here in our city. Okay, we are going to move on with something more cheerful, and that is celebrating and kicking off our Lunar New Year celebration week. So I'm going to shift up to the podium and invite some very special guests up to join me in proclaiming the Lunar New Year, the Chinese New Year, which is about to begin. Okay, as I said, the Lunar New Year, is one of the most significant annual celebrations we have here in Vancouver for our Chinese, Vietnamese, and Korean communities. This is a big deal, and on Saturday, it's the beginning of the Year of the Rooster, and that is a year in particular. The Fire Rooster is the cycle that we're in now, and I'll tell you a little bit about the Fire Rooster. Those who will be born in this year to come will be born with a strong sense of timekeeping and responsibility at work. I can rub off on the team here. People born in the Year of the Rooster are very observant, hardworking, resourceful, courageous, and talented. Roosters are very confident in themselves. Any counselors, roosters, by chance? So it is the Year of the Rooster starting on Saturday, and today we have representatives from community agencies here to receive the proclamation, who I will now ask to join me at the podium. We have, I'll just introduce you all, and if you could come up to say a few words and have a picture all together. Hilbert Yu is here from the Chinese Benevolent Association of Vancouver. As Fred Kwok is here, no, Fred's not here. Willie Chan from the Vancouver Chinatown Merchants Association. Grace Wong, Chair of Success. Mike Jiang, the Chinese Freemasons, Vancouver branch, and of Raymond Tam of the Shawnee Benevolent Association. Come forward. Scoot over here a little bit. And I'll just read our proclamation here. Whereas the City of Vancouver is home to a multitude of cultures and languages from around the world and values diversity as a source of strength, and whereas the City of Vancouver believes that celebrating diversity, be it gender, ability, ethnicity, religion, or sexual orientation, helps to create a vibrant community in which all individuals excuse me, can live in mutual respect and peace. And whereas the City of Vancouver is home to a large and diverse Asian Canadian community that has contributed significantly to the social and economic vitality of our city, and whereas the City of Vancouver believes that sharing and celebrating community-based festivals enhances the connection between citizens of diverse cultures and interests, and whereas Lunar New Year celebrations encompass many traditions, including that of Chinese, Vietnamese, and Korean cultures, and is one of the most important holidays of the year for many Vancouver residents, and whereas Lunar New Year has become an integral celebration in the City of Vancouver, now therefore I, Gregor Robertson, the Mayor of the City of Vancouver, do hereby proclaim the week of January 23rd to 29th, 2017 as Lunar New Year Celebration Week in the City of Vancouver. So with that, I'll ask our guests to say a few words. Maybe I'll pass. Just one of you going to speak? Hilbert, you're going to speak? Okay.
Thank you. On behalf of the Chinese Benevolent Association and the Chinese community in Vancouver, I would like to thank City Vancouver for this award. Excuse me. The Vancouver Chinatown Spring Festival Parade will return for the 44th times this year. The City of Vancouver has supported this popular parade with efforts from many departments, including street closures, traffic redirections, police department, fire departments, and the performance from the Vancouver Police Motorcycle Drill Teams. We appreciate the generous support and look forward to making this year's parade bigger and better, and wish everybody good luck, good health in the years of roosters. Thank you.
On behalf of the Vancouver Chinatown Merchants Association, I wish you all the best of the Chinese New Year. 恭喜發財.
Thank you. Thank you, Mayor and Council, for the proclamation. On behalf of Success, and as many of you know, part of our mission and vision is, of course, the promotion of multicultural harmony. And the Spring Festival celebration is part of that celebration of multicultural harmony in Vancouver. So we're looking forward to a great weekend. Success provides all the volunteers for the event on the weekend. So we're all looking forward to it. Thank you very much.
Oh, thank you very much.
On behalf of the Song Yi Benevolent Associations, I would like to thank you, the City of Vancouver, to support and organize this event. On this Sunday, I would like to, on behalf of the whole committee, invite everyone from the Greater Vancouver, come and join us in Chinatown for the festival parade.
And thank you again to all of you who work so hard to make sure that the Spring Festival Parade is such a big success every year, bigger and better. We hope this year. We'll hope for good weather, as always, to keep people dry, but it doesn't matter. Rain or shine, it will be a great parade, as always. Thanks for all of your hard work to organize the parade, and a Happy New Year, healthy and prosperous New Year to all. And that, thank you for being here. So we will hopefully see many of you at the parade in Chinatown on Sunday, middle of the day. In the meantime, we've got a council meeting here to dive into, and next on the agenda is our in-camera requirement where council is required to meet later in camera later this week. The reasons and authority under the Vancouver Charter are listed in the updated agenda. Would someone like to move that motion? Councillor Deal will move. Councillor Stevenson seconds. All those in favor? Any opposed? And that carries. So we're on to minutes from the last set of meetings. First, from the regular council meeting of December the 13th, 2016. Any corrections to those minutes? Councillor Jang will move adoption. Councillor Deal will second. Any debate? All those in favor of adoption? Any opposed? That carries unanimously. The second set of minutes are from the public hearing, December the 13th, 2016. Any corrections to those minutes? Moved by Councillor Deal, seconded by Councillor Jang. All those in favor? Any opposed? That carries. Minutes 3 are from our regular council meeting that followed the City Finance and Services Committee meeting on December the 14th, 2016. Any corrections to those? Moved by Councillor Jang, seconded by Councillor Deal. Any debate? All those in favor of adoption? Any opposed? And that carries. So we've adopted all the minutes from those last 3 meetings in December. And we're on to our consent agenda items. And we have 4 administrative reports, 3 policy reports, and 1 other report on the agenda for consideration. Excuse me. And council may adopt the recommendations in these collectively in a single motion. I'll ask if any member wishes to hold any of the items for debate or questions to staff. Anyone wish to hold a report? Seeing none. That's a rare occasion. That means hold on. Does any member wish to hold or wish to declare a conflict of interest on any of the other items and have that item voted on separately from the rest of the consent agenda items? That's a no as well. So that means we need someone to move adoption of the recommendations before council contained in all of those reports which are being held for debate. Questions of staff? And we're not holding any of those. So Councillor Jang, you will move. Councillor Stevenson will second. And any debate on the consent agenda motion, which moves all of the recommendations in all of those reports? Okay, we're ready for the question. All those in favor of the consent agenda? Any opposed? And all are in favor. So that carries unanimously. And that means we have excuse me, we have approved all of the reports in this council agenda. And I will, do you need me to read the titles of all of those reports? Okay, I will do that. So we have approved the following reports. The administrative reports are the first being the Vancouver Community Sport Hosting Grants 2016-2017 winter intake. The second is 2017 advanced grants to cultural organizations. Number 3 is the funding applications to Federal Rail Safety Improvement Program. Number 4 is 3580 Gravely Street land exchange for road purposes. And our policy reports, number 1 is the CD1 rezoning for 2106-2138 Main Street. Number 2 is CD1 rezoning 4621 to 4663 Canby Street and 605 West 31st Avenue. And policy report 3 is the CD1 rezoning for 1380 to 1382 Hornby Street and 801 Pacific Street. And finally, the other report is naming of civic asset White Pine Mill Pump Station. So all of those reports, their recommendations have been approved now by council. And that means we are on to our report references. We have 3 substantive report references today. And the first is an update on the opioid overdose crisis, the fentanyl overdose crisis. And we have Paul Mokry here, our Deputy City Manager, as well as Dr. Rika Gustafson, Vancouver's Chief Medical Health Officer from Vancouver Coastal Health, are here to present. And council has also received requests to speak to this item. So should council wish to hear from the speakers, we can refer consideration of the related staff report to tomorrow's Standing Committee on Policy and Strategic Priorities. So we can hear the presentation from our team here and have a round of questions, and then have the speakers come tomorrow and council hear speakers and consider the related report starting tomorrow morning. Okay, we have a motion to refer to hear speakers tomorrow, refer the report, moved by Councillor DeGenova, seconded by Councillor Ball. And all those in favor, any opposed? That carries. So we will hear the presentation now and have a round of questions. Mr. Mokri, welcome.
Thank you, Mr. Mayor, Council. It's a pleasure to be back to see you all again. So I'm going to invite Dr. Reka Gustafson, Medical Health Officer with Vancouver Coastal Health, to start off with an update to you on the opioid overdose crisis. And then I'm going to follow that up with a presentation on the city's response to the crisis and measures that we're recommending for implementation in 2017. So with that, if I can turn it over to Dr. Gustafson.
Welcome.
Thank you. Hi, thank you for having me. How do I move the slides?
You can lower the, yeah, there you go.
Oh, thank you for doing that. Okay. Good morning. Again, thank you for having me. I'm here today with Dr. Patricia Daly, the Chief Medical Health Officer for Vancouver Coastal Health, as well as Miranda Compton, from the Director of Prevention from Vancouver Coastal Health, who's been working with your staff in coordinating the response to the fentanyl overdose. As most of you have probably heard, the coroner of British Columbia released the final numbers of deaths from illicit drug overdose, which were 914 in 2016. So as you know, this is a very high number, higher than anything we've experienced before, and very much higher than the numbers in the late 90s when another overdose, public health emergency was declared in the downtown east side due to illicit drug overdose deaths. In Vancouver, until the middle of the summer, our rate of illicit drug overdose deaths was actually similar to 2015. But unfortunately, due to very high number of deaths in November and December, by the end of the year, Vancouver had the highest number of deaths and the highest rate of deaths of any municipality in British Columbia. And we are learning a great deal from the coroner, actually, about the deaths. And one of the important things we are learning about the deaths is that 86% of them happen indoors. Many of these individuals are injecting alone. And in particular for Vancouver, 46% happen in residences that we designate as other residences. These are hotels, motels, single room occupancy hotels, and shelters. As you know, the response to this very high number of deaths has many elements. One of them is, of course, naloxone. This is an immediate response action, and Dr. Daly has updated you on those activities some time ago, and these graphs just show you the ongoing efforts to disseminate take-home naloxone kits to anybody who is at risk or anybody who knows someone who is at risk of a drug overdose death. Also on December 13, the mobile medical unit was opened at 58 West Hastings, and that was really in response to the very high number of overdose emergencies that were presenting to the emergency department, really causing a significant impact both on St. Paul's Hospital and on emergency health services. Up to January 15th, 613 patients have been seen there, about an average of 20 a day. 262 had overdoses, and many other individuals are presenting to start on treatment, Suboxone treatment for their addiction. Another part of the response is expanding supervised injection services. It is important just to remind you that to date, including during this crisis, there have been no deaths at any supervised injection services. And so now at Insight, the Insight is now open 24 hours for the 3 days during the week of social assistance check distribution, and that's because we frequently see peaks in overdoses and overdose deaths during that time. 2 applications have been submitted for additional supervised injection sites. And under a ministerial order And in response to the very high number of deaths in November, 5 overdose prevention sites were also opened, which are really to make sure that individuals have an opportunity to inject in a supervised setting. So should they experience an overdose, there is someone to respond to that overdose. The graph shows you the number of people that are starting to attend these overdose prevention sites, and depending on the sites, they're more or less busy, and we are evaluating really the appropriateness of the services to make sure that we continue to support the services that are best suited to the needs of people who are suffering from addiction. And the last part that I'm going to talk about is really expanding treatment access. The expanded access thus far has included the opening of the Rapid Access Addictions Clinic at St. Paul's Hospital. They also opened a Suboxone Start unit. Christy Sutherland and her team is also providing addictions treatment. Crosstown Clinics at 84 West Hastings is providing injectable hydromorphone and diacetylmorphine treatment, and coming soon, the Connections Clinic will open on March 1st to provide expanded access to addictions treatment. And also there's been significant removal of barriers to Suboxone treatment over the past year. In the summer, a special license was, the college has removed the requirement for a special license to prescribe Suboxone, so any family physician with the appropriate training can provide a Suboxone prescription. Over the summer and the fall, significant efforts were made to train physicians to prescribe Suboxone, and as of February 1st, 2017, Suboxone will be free to anyone on social assistance or anyone who's making less than $42,000 a year. There was also last week a $10 million announcement of additional new beds for addictions treatment. We at this time don't know what proportion of those beds will be for Vancouver, but that additional announcement was made. So these are the components of our emergency response. But really, I feel I need to stress that despite this significant effort that has been made, early numbers from the coroner from January indicate that the number of deaths continue. So this crisis, we are not really succeeding in getting ahead of this crisis thus far. And it is becoming more and more clear to us that we can't emergency respond our way out of this crisis. We need to address some of the root causes of the crisis. And because of the number of people who are dying today, who died last night, we really don't have the luxury of time to address these root causes. And two that I'd just like to point out, really, one is the fact that the reason that toxic contaminants like fentanyl and carfentanil are part of the drug supply is that the drug supply is illicit. And the other is that the stigma associated with addictions has slowed our willingness to treat and to incorporate what we have learned about addiction over the past decade into our response. And the thing that we learned about addiction over the past decade is that, like diabetes, like lung disease, addiction is a chronic relapsing medical condition. And like other chronic relapsing medical conditions, it has many other features of chronic relapsing medical conditions. The addiction results from an interaction between genetics, the environment, experiences, and behavior, many of those experiences in early childhood. Relapses are very common and expected, just as they are expected with any other chronic disease. A range of therapies are needed. There is no one solution for anyone. So for example, for somebody with diabetes, we don't say that exercise and diet and the pills are okay, but insulin are not. And we provide for people with chronic medical conditions, we provide the whole range of treatments that are available to them that are evidence-based. The goals of therapy of all chronic diseases are to prolong and improve quality of life, restore function, reduce complications, not necessarily cure. And I'd just like to remind everyone that addiction is not a choice. And once people are addicted, their physiology changes. So they are no longer taking drugs, even if in the acute phase they were taking drugs to have euphoria or to treat their pain, or psychological or physical. Once a person has a suffering from addiction, they are no longer, that choice is removed for them, and really they are needing to take take the drugs to treat the symptoms of withdrawal. So it is really important, I think, to remember that people who are suffering from chronic addiction don't have a choice in the matter. They're suffering from a chronic treatable medical condition. And if we address those two things, the fact that addiction is a medical condition and the fact that stigma is contributing, and that the root cause of this crisis, of this very large increase in deaths, is the toxic contamination that's made possible by these drugs that are illicit, the next immediate steps become very clear. The immediate step that we are taking with your staff is to create safe spaces and housing and improving social supports to reduce the likelihood of using alone. The data support this action, and we also know the rationale for it. Stigma leads to social isolation, using alone, and a much higher risk of overdose. And again, the numbers bear that out. The next thing we need to do is, and we need to again do this very rapidly, we don't have the luxury of time, is to remove the barriers to the full range of treatment options, including injectable opioid therapies, including hydromorphone and diacetylmorphine for anyone who's suffering from addiction, because at this point, all of these individuals must be given an option, an alternative to using illicit drugs. And in the medium term, given that we know what made this possible, it is time for us to advocate for the public health approach to regulate the production and distribution, form, and concentration of psychoactive substances to prevent these preventable deaths. So that's my update, and I'm happy to take any questions that you have.
Okay, thank you very much for that update, and thanks to Dr. Daly as well for being here on behalf of Coastal Health. Mr. Mokri, do you have more?
Yes.
Okay.
Mr. Chair, if we can proceed through our update now for council. Just get the So the context for this update today are motions that Council will recall you passed before the break in December. One was part of the 2017 budget motion and allocated a contingency for 2017 to cover the cost of recommendations that staff would be bringing forward this year to address the crisis that Dr. Gustafson has outlined for you. Additionally, Council passed a motion on December 16th allocating funds within the 2016 operating budget at the discretion of the City Manager to spend. And so today the report that you have in front of you provides or contains two recommendations. One is an information update on 2016 expenditures, which I'll speak to, as well as an initial set of recommended investments for implementation in this year to be funded from that contingency reserve in the 2017 operating budget. So Council, with respect to measures implemented in 2016, there were a range. And I should say to start that not all of these recommendations were implemented directly pursuant to Council's motion on December 16th. These were largely implemented or in motion prior to that motion. And the funds that I'll speak to here were absorbed within the 2016 operating budget as essentially as operational decisions. And there's a number of responses that the city participated in or took last year. First, supporting Vancouver Coastal Health's applications for 2 new supervised injection sites. And ensuring that the necessary city approvals were in place for those operations. The city played a role in facilitating the deployment of the mobile medical unit that Dr. Gustafson spoke of to the city's property at 58 West Hastings. The city did incur costs associated with that effort to the tune of approximately $55,000. And those costs were essentially for preparation of that site and utility connections for the mobile medical unit. The city has also played a role in supporting, although not funding, the overdose response sites that Dr. Gustafson spoke of as well. The Vancouver Fire and Rescue Services, the fire chief authorized the deployment of an additional medic unit to Fire Hall number 2 on the downtown east side, commencing at the beginning of December. and staffed that additional unit through a combination of staff redeployment and overtime. They incurred a cost, the department incurred a cost of approximately $43,000 through the month of December to maintain that unit. The unit was staffed through a combination of redeploying one crew member off of an existing apparatus at hall number 2. There are 2 heavy apparatus at that hall, 2 engines. One of the crew was deployed to an additional medical unit, as well as 2 supplementary staff, like I say, that were staffed through overtime. So that's the cost associated with that. And I'll give you some context on the impact that this crisis is having on Vancouver Fire and Rescue Service. The city was also instrumental in facilitating the lock zone training for 300 individuals, primarily in the downtown east side, residents and drug user groups. So these are now individuals that are active in the community and have intervened in countless number of cases to prevent overdose deaths in that neighborhood, as well as you'll recall the Mayor's Forum that the city hosted in December, bringing together several hundred people here at City Hall to talk about the impact of the crisis and the role that the city and other levels of government can play going forward in resolving it. And there were some costs associated with that effort as well, to the tune of $9,000. So again, as a proxy for the impact on the city, we've certainly heard from our partners at Vancouver Coastal Health on some of the impacts on the healthcare system. Vancouver Fire and Rescue Service, as you know, is really at the front end of responding to this crisis in terms of providing emergency medical response to individuals suffering from overdose around the city. Provided some data here on the impact in 2016 of this crisis. The graph on the left indicates the number of overdose incidents that Vancouver Fire and Rescue responded to, and that's strictly the incidents where the response came from hall number 2 on the downtown east side. So 175% increase year over year, 2015 to 2016. Although unfortunately, if you look at just the monthly comparison, December 2016 versus December 2015, the increase is even more dramatic, 275% increase in overdose calls responded out of hall 2. Again, confirming the data that we've seen from Vancouver Coastal Health that the impact of this crisis is actually escalating over the last few months of last year. Obviously, that's a staggering impact in terms of that neighborhood in particular, but also on our first responders who are doing their best to address the impacts of this. In terms of total incidents, and again, this is for Fire Hall 2 alone, the total calls responded from that hall increased almost 50% last year. And again, in the month of December, almost 78% over the December in 2015. And I should say that although we've used Fire Hall 2 as really the hall that's most impacted by this, this crisis is impacting our entire community. Vancouver Fire and Rescue across the board, all of the halls are seeing the impact of this crisis. For overdose, if you include halls number 1, which is Strathcona, and hall number 8, which is Yaletown, those 3 halls together saw a 258% increase in overdose calls in December. So certainly the response districts around the downtown, and in fact across the city. Roughly 40% of the overdose calls that Vancouver Fire and Rescue respond to are outside those 3 halls. So they are spread across the city. This really is a community-wide crisis. So looking at 2017 then, staff are putting forward today 3 sets of recommendations for your consideration. There's a number of principles that have been guiding the development of these. First and foremost, looking at practical and immediate measures that the city can implement to save lives and mitigate the impact of the crisis on people who are directly affected and also our communities. We are engaging as much as we can, our teams, with people in the community, so people with lived experience, residents, our business community, nonprofits operating in the downtown east side, and others. Looking at building resiliency and capacity to this. Again, this is not a short-term crisis that we're dealing with here. As applicable, looking at best practice and evidence base, and where we can ensure value for money and leverage. I would say that the first 3 recommendations that you're going to see today are primarily kind of immediate practical response. I don't think these three today are really getting at root causes. There's more work we need to do around that. Today, the three are very much addressing and mitigating the impacts of the crisis as they're happening on the streets today. So the first and most significant from a financial perspective investment is the continued deployment of the additional 3-person medic unit at Fire Hall 2. So this medic, as I indicated, is operational currently. As of earlier this month, the additional staffing complement has been expanded from 2 firefighters to 3, such that the 2 heavy apparatus at that hall are both remain available for fire suppression. So there are 3 units now functioning at that station. The department is continuing to staff those additional 3 members through overtime and staff deployment, and would continue to do so. The recommendation that we're putting to you, Council, is to actually augment Vancouver and Fire Rescue regular staffing so that there would be 3 additional regular positions staffed 24 hours a day at that hall. The associated cost of that is $1.9 million. If the department were to staff through overtime, the operating cost could be slightly less, probably in the range of 1.7, but obviously the impact of continuing to staff that unit through overtime has other pretty significant implications on the department and firefighters. So given the fact that we don't see any short-term diminishment in call volume at Hall 2 or in that response district, we do believe it's appropriate to staff and augment through regular staff. We would continue to monitor the demand. If we do see a change over time, the department would be able to absorb those staff through attrition. So, but at this point in time, our recommendation is to have that crew established as a regular staff complement at Hall number 2. The second recommendation is there's essentially 2 elements here. One is to establish a new community policing center in Strathcona. Currently, there are 10 community policing centers operational throughout the city. This would be an 11th in that neighborhood. As you know, Strathcona is currently undergoing a rapid rate of change, development, growth in residents and businesses moving into that neighborhood. It is adjacent to the downtown east side, is certainly seeing the impacts of the opioid crisis. There are services, important services located in that community, including the 2 new supervised injection sites that the community has supported. But additionally, the impacts are being felt there, certainly with the encouragement to individuals to not use drugs alone. There is an increase in outdoor drug usage. The community policing centers are, as you know, community organizations. This isn't so much about Vancouver Police Department resources. The VPD would assign a liaison officer to the Strathcona CPC, but these organizations are community organizations. They really are about providing a focal point for community safety concerns in the neighborhood, and for volunteers to organize, deliver programming, including patrols in the neighborhood. We believe and agree with the neighborhood. This is something that the neighborhood has certainly asked the city and VPD for. We have heard that from the residents there, from the businesses in that community, as one measure that we can take to assist that entire community in addressing the impacts of this crisis on the neighborhood. The second element of the recommendation is to provide essentially an inflationary funding increment for the other 10 CPCs. So it mentions 11 there. The current funding that each community policing center gets as an annual funding grant is $108,200. That number has not been adjusted since 2009, so there's been significant growth and pressure on these organizations. And again, this crisis is impacting around the city. So the second element of this recommendation is to provide an inflationary adjustment to that $108,200 by an amount of $20,000 for each CPC. So that would be $20,000 for each of the 10 existing, plus an increment to Strathcona, which brings it to the $220,000. And again, we see that as an appropriate response in supporting those other community policing centers addressing the needs in their neighborhood. I know that, for example, the Granville Community Policing Center, their volunteers collected over 1,200 needles last year. So these volunteers are out. They are additional eyes on the street to understand kind of what is going on in those communities, address the impacts, ensure that if there are people in those communities who are on the street that need assistance, we can direct that to them. Needles are a big issue across the city, as you know, so these community organizations can play a big role in addressing that and responding to it. So this is the second element, is an additional CPC for Strathcona and support for our existing 10. And the final recommendation, specific recommendation for you today, Council, is to expand naloxone administration training for city staff. In addition to our firefighters, we have provided training and naloxone kits to a small number of city staff working in our downtown community centers. We believe there's an opportunity to expand that to other staff working in the downtown east side and in other frontline services. The cost is relatively minor. It's primarily for providing naloxone kits and then the staff time to train those staff. The training itself we would deliver in partnership with Vancouver Coastal Health or Vancouver Fire and Rescue. We are also in contact with our unions and are keeping them apprised of the protocols that we have in place for administration of naloxone by city staff. It is voluntary. So again, other than for our firefighters, we're not obliging any of our staff to provide this type of extraordinary first aid, but it is something that many of our staff are prepared to and have stepped up and indicated that they would be able to assist in providing what is obviously an essential life-saving intervention. So in addition to those three recommendations, Council, staff are working on a whole number of other concepts that we would anticipate bringing back to you, likely as additional recommendations to be funded out of this contingency over the coming months. And those include kind of a number of topic areas, including overdose prevention in both private and publicly funded SROs. Staff are looking at public education awareness and prevention initiatives. Certainly a support for Aboriginal healing and wellness. Aboriginal people, as you know, are certainly overrepresented on the downtown east side and in the community that's being impacted by this crisis. Needle management, I mentioned needles, the growth of complaints regarding needles in public spaces has grown significantly over the last year. That's an issue that we're concerned about. It creates a kind of broad-based public safety concern for the community. So we're looking at that, and also low barrier employment opportunities to support individuals in their recovery. So looking again to get ahead of the crisis. We've also, the recommendation that Council passed in December called on staff to advocate with the provincial and federal governments for contributions. Specifically with respect to the costs incurred in 2016 by the city, we have had discussion with Vancouver Coastal Health about the cost of deploying the cost incurred by the city for deploying the mobile medical unit, and Vancouver Coastal Health has indicated that there's a commitment there to reimburse the city for those costs. And then there's been ongoing discussion, I think, going back as far as November, where the ministers of health for both the federal and provincial governments were here in Vancouver, met with elected officials, city staff, firefighters at Hall Number 2 to talk about this crisis. And that dialogue and advocacy has been ongoing. I understand the mayor was in Ottawa as of last week, and this was a topic addressed with other big city mayors and the federal government. So those advocacy pieces for contributions from those governments are ongoing. In addition, there are a number of points that we have been advocating for with both the provincial and federal governments, and I would say they align very well with what our colleagues, public health colleagues, are advancing as well, and the points that Dr. Gustafson made earlier this morning. So certainly for both the federal and provincial governments to fill service gaps in terms of both treatment as well as substitution therapy, including injectable therapies, the continued support or reinitiation of support for the Housing First model to ensure that people who are suffering with addiction have stable environments in which to pursue their recovery. Data is a key element of the response, obviously, so ensuring that all the agencies involved in the response have access to the relevant data and have access to that data in a timely way. I think ensuring that public health agencies are continuing to analyze the overdose data in a very robust way so that we can identify risk factors and additional mitigation steps that we can implement. Partnerships are key, advocating the federal government in particular to acknowledge the scale of the crisis. I think our provincial government has been in step with us in that regard, ensuring that addiction support and mental health is adequately resourced at a macro level, having the federal government take steps to replace Bill C-2 and ensuring that there are not unnecessary obstacles to the provision of services like supervised injection support. And then working proactively with local governments and First Nations as key partners in the response. And finally, and I think importantly, as Dr. Gustafson said, to start to get ahead of at root causes. So the stigma associated with addiction, ensuring that governments are taking the steps they need to take around poverty reduction and housing, which is obviously something that the city's been advocating for many years now. Early childhood development, again, another priority for the city, and shifting Canada's approach to drug use from prohibition to regulatory. And again, I think a statement here from BC's Chief Medical Health Officer that, again, is very consistent with what Dr. Gustafson mentioned this morning around really revisiting Canada's approach to drug regulation. And addressing the fact that this cause is really this crisis is a function of contaminants in an illicit drug supply. And until we address that, we're going to be swimming upstream, I think, on an ongoing basis. So finally, Council, if I could, just to acknowledge certainly the impact of this crisis, the number of deaths over the past year or past years is staggering. Obviously, that's impacting a huge number of people in our community who've lost loved ones. The contribution that volunteers and residents, particularly in the downtown east side, are making to response can't be understated. There are many, many people and agencies, groups that are working tirelessly to prevent the deaths of their neighbors. Certainly our partners in this, Vancouver Coastal Health, BC Emergency Health Services, BC Centre for Disease Control, BC Housing, the many non-governmental organizations, and also the business community who are really engaged in addressing this crisis, and city staff from across our organization. I'm here just to give you a high level today, but we've got many of our staff who are involved from Vancouver Police Department, Vancouver Fire and Rescue, certainly Community Services is front and center on this as well. And there's a lot of staff, as you know, who are not here today who are involved in working on this. So with that, Council, Mr. Mayor, I'll open it up for any questions you may have for us.
Okay, thanks very much, Mr. Mokri, and to the whole team for pulling this update together, and to our guests from Vancouver Coastal Health. Thanks for being here. So we have referred hearing from speakers on this to tomorrow's committee meeting tomorrow morning, but we're going to have a round of questions from council for the staff team who are here. And Councillor Jang, you are first on the queue.
Thank you very much, Mr. Mayor, and thank you to everyone and all the hard work. I know it's been a very difficult Christmas season. I know certainly all of us at my other job at UBC, we put in a lot of hours over this. A couple questions. First of all, I get a lot of letters complaining about this 0.5% tax increase and what are you going to use it for? And as far as I can tell from the staff report and your recommendations, that these are items that are within the city mandate. We're not taking on anybody else's downloading. Is that correct?
Yes, absolutely. Through the chair, certainly emergency medical response provided by Fire and Vancouver Rescue is a base service. It represents a significant amount of work that our firefighters do every day. Policing is clearly within the mandate of the city, and supporting community organizations with public safety through community policing centers and training city staff, I would say, is directly within our mandate.
Great, thank you very much. The second question I have is on some of the community groups. There's a number of community groups who are doing absolutely amazing work, patrolling streets, the alleys, administering naloxone and other services. Who are they being funded by? I believe it's like BCCDC and Vancouver Coastal Health. And will that continue? Maybe Dr. Daly can comment on that.
We are funding a number of those groups, so Vancouver Area Network of Drug Users, Portland Hotel Society, and they're under Vancouver Coastal Health contracts, and those will continue into the new year.
Great. And do we see an expanded role for them in the future, or?
This crisis is not going to end soon, so we know we're in it for the long term. So a number of those contracts, we're evaluating what makes sense to continue, what things we may change as we move into the spring, but they're going to continue in the long term, and we may expand some of the for example, one of the areas we know we need to look at, and it was mentioned by both speakers, is supportive housing units and finding safe places for people in those units to inject so they're not alone in their rooms. That means training of staff, providing of supplies. So there may be other things that we do, so we're not stopping that funding. Great,
thank you very much. Another question I have, that's for Paul. I know that the effects of trauma on our first responders, whether they're police or fire, and I know that trauma is being debated now in Parliament about PTSD. I noticed that in the 20 things that we're considering, there will be some what wasn't really explicitly mentioned was mental health services and support for our staff. Certainly I see with our residents at UBC and all that, they're going through a very difficult time when they go through this. Are we contemplating that?
Yes, thank you for the question. We had indicated, as you mentioned, in the information that came forward before Christmas, a recommendation that we expected to be bringing forward around enhanced mental health support for Vancouver Fire and Rescue, and then potentially leveraging that for other city staff. That is a program that we're currently working on, staff and HR, as well as with Vancouver Fire and Rescue and with staff in Vancouver and Fire Rescue to pull that program together. That is a recommendation that we anticipate bringing forward. Certainly there is a need there. We are very much committed to that, and just need a bit of time to fully flesh that program out so we can bring it back with the detail for your approval.
Great, thank you very much. And perhaps another question to Coastal Health. And I guess the question really is that I've noticed that you've started to call for, and I'm very glad for this, for doing what many of the European cities have done to actually combat their overdose crisis. For example, heroin-assisted treatments and therapies, more treatment on demand and things like that, and I hope that advocacy continues. And I've written about that both publicly and in academic journals, but I think, do you think that's the way to go, like the European experience? Or certainly learning from those best practices?
I think we need to focus most immediately on getting everybody off illicit drugs, everyone we can off illicit drugs, onto a legal alternative, because the bottom line is this is a contamination of the illicit drug supply. It does mean a whole host of substitution therapy. Not every person with a chronic opioid addiction is ready to go on treatment. They're not necessarily ready for detox treatment beds, and those services may pose risks to them, because when you go into detox, you get off your drugs, you lose your tolerance to the opioid. So if you relapse upon discharge, you're at high risk of dying of overdose. In fact, we've seen many people dying, leaving detox in recovery homes, who've been or coming out of jail, who've been off drugs for a while. We need a whole host of substitution therapy. I completely agree. Suboxone is one such oral treatment. It is now the recommended oral treatment of choice, replacing methadone. But we do need injectable options, because not everybody will do well on oral treatment. Not everybody wants to go onto oral treatment. We do offer prescription diacetylmorphine, which is prescription heroin, at one clinic in Vancouver, and prescription hydromorphone, which is another opioid that's actually a legal drug in Canada that's used in our hospitals. Those are challenging models to expand. It requires training of physicians. It requires pharmacy support on site. It requires security to house those drugs. The heroin, for example, is only available in Europe. We have to import it. There's no manufacturer here. But we do need to start getting people off illicit drugs onto those legal substitutes. We've also called for, as a first step in the regulatory approach, or at least I've called for, the federal government to strongly consider decriminalizing all illicit drugs now. That's a first step on that regulatory approach. And the reason why that's important, it doesn't get rid of the contamination in the illicit drug supply, but it deals with the stigma. We know that across BC, even in Vancouver, there's still significant stigma associated with addiction. In some places, they've opened overdose prevention sites and no one's coming to inject. 90% of people across the province are dying because they're indoors alone. If we can get rid of some of the stigma, if people don't feel they'll be arrested for possession, which would be the case if we decriminalize illicit drugs, we might be able to bring these people out of the shadows and offer them some of these other treatment supports. So those are the two things I think we need to really start talking about.
Great. Thank you very much.
Okay, that's your time. Thanks, Councillor Jang. I've got myself on the queue here. I'll just jump in and ask a few questions, and maybe just a quick update. I was in Ottawa late last week. On Friday, met with the Prime Minister along with big city mayors from across the country. We spent considerable time discussing the impact and sharing. I was sharing the stories and the data from Vancouver. What struck me was that most cities across Canada actually don't have data on how many overdose deaths or interventions are happening. They have some data from their first responders, but it's spotty, and depending on the province and the city, there's no standard of data collection currently, which is quite shocking. I think they were all stunned to see the increases that we've seen, obviously year to year, but what's happened in the last couple months is an unbelievable tragedy, and the number of people we've lost in these past couple months, I think should give our federal government, and certainly the Prime Minister spoke to this, a real cause for alarm. And if ever there was a reason for the federal government to treat this like a national emergency, there was some discussion about invoking a state of public welfare emergency. But the federal government's response has been that they have all the powers that they need to take whatever measures are necessary without that being in place. The important thing is that they do start to respond that way, and I was impressed. The Prime Minister has certainly been briefed and is well aware of many of the, I think, international best practices, as is the Health Minister and her team. We just need to see, I think, coordination across the country, and provinces all supported and coordinated, and cities in the mix as well. So hopefully that's what is coming. In terms of the data here, just a question on what we have available. Do we understand how many people are overdosing and then dying in some of those cases based on the drugs that they're using, intravenous drugs versus pills? Is there accurate data in terms of that drug use and what is leading to these overdoses? We know inside versus outside in some of these drivers, but the drugs being used, recreational versus addicts, that kind of detail.
So we are getting those data or those analyzed data from the coroner. The numbers are not yet complete for 2016, but we knew that up until about October, fentanyl was found in about 60% of people who had an illicit overdose death. And they also do provide and analyze information about what other drugs are available or not available, are present in the blood of individuals who have died. So those data are available, and one of the things we learned from that is that the vast majority of people who die from an overdose have multiple illicit substances in their, or psychoactive substances in their bloodstream, and about 60% of them up until about October had fentanyl. One of the things that we don't know is, and there's certainly some initial evidence from testing through the police that carfentanil likely contributed to the spike in November and December. That is not something that the coroner is able to test for. So that is not information that is available to us. So the coroner, we are also working with the Chief Coroner of British Columbia to provide individual level data so we can analyze not just the biological or the drug testing data, but also what were the circumstances of the individual, what were the interactions with the healthcare system prior to their experiencing a fatal overdose. And so I think we certainly have found that those data are actually critical, and that we're hoping to receive them in the next month or so.
Okay, I guess I'd heard that that BC won't have the capacity to test for carfentanil for many months into the spring, and that the Alberta government and health system was on this earlier last year. Do you have that capacity? But for some reason, BC did not.
That capacity
action?
is going to be in place in BC. So it's one of the things that the provincial government is committed to doing, is to purchasing the equipment available to do that kind of testing, and or to look at other drugs or other labs that can do the testing. Dr. Gustafson is correct. Right now, our evidence of carfentanil comes from the police, and we thank them because they, in Vancouver Police, at the home of someone who died of an overdose in November, took remaining drug and had it tested and found carfentanil. But so far, the coroner has not been able to do that test. We will have that capability. And just to comment a little bit about the coroner's data, I do speak to my colleagues across the country, and there is a challenge in getting coroner's data in every province. We probably have the best data of any province, the most timely data, and the fact that the coroner puts it on their website within a month of the previous month's data is up, and we can see it. The definitions for illicit overdose deaths, you're absolutely right, may differ across the country. This is something that the coroners are discussing nationally, to have the same definition and to provide good data. But some of my colleagues across the country don't have data even from last year. They're dealing with the year before that. So we are fortunate. As to one of the other things we do want to, just to address your other question with the coroner's data, the question about, is this recreational drug use? Is it injection? The vast majority of deaths are people who are chronic opioid addicts, or these are not recreational drug users per se, from what we hear from the coroner, just to confirm that even people you may read about in the press that on first appearances appear perhaps not to be, the testing shows they have multiple drugs in their system and probably have a chronic addiction problem.
Okay, that's helpful to know. And in terms of, I guess what surprises me, and maybe you could speak to the January trends, because what we saw in November and December, for there not to be an absolutely, DEFCON 5 response here to that,
Yeah.
the scores and scores of deaths, is that continuing into January?
We do get alerts from the coroner, and I don't think the data from January will be promising. We won't know for certain until we get the coroner's data. Having said that, our emergency department data and some of the ambulance data shows a bit of a decline. Now, the worrisome thing is if deaths are going up or not decreasing, and we're seeing a decline in ambulance calls or emergency department visits, because that's the concern then, that people are dying without even getting the chance to call an ambulance. You're absolutely right that I would say that we have been slow to move to what we believe now is so critical, which is rapid expansion of substitution therapy for people with an opioid addiction. Naloxone won't prevent the overdoses. Overdose prevention sites are helpful, but in some places in the province, we're not seeing large numbers at those sites. People are still dying, and most of them are dying alone. We do need to, and this is the health system really does need to do this, more quickly expand opioid substitution therapy. It's challenging, even in Vancouver, where we have some of the best addiction doctors in Canada, Dr. Evan Wood and others, to train the physicians to be able to provide this therapy, to make it available, to engage people. We've been working at the mobile medical unit, just as one example. Everyone who comes in is offered opioid substitution therapy. Many aren't ready to even consider that when they come in. We've just put them into withdrawal. All they want to do is go out and seek more drugs to relieve the pain of withdrawal. But to get those people on opioid substitution and keep them on it, it's going to take time, even though the deaths are very, very concerning. So we're working as hard as we can, working with addiction colleagues. That's really the next stage, where we need to identify physicians in the community who are willing to manage these patients and provide them the kind of supports they need for their substitution therapy, which is not easy.
Okay, that's my window of time there. Councillor Reimer is next on the queue.
Thanks, Mayor Robertson. I think my first questions are for the Coastal Health, for Dr. Daly. So 91% of deaths inside, half in SROs. I'm not, well, maybe this is a staff and VCH. I guess I'm curious, none of the strategies in this report appear to focus on those 91% of deaths. So I'd like some sense of what does focus on supporting better interventions inside.
We have been, although we didn't give all the details, we have been providing naloxone to some supportive housing units and training to some of the agencies that staff those units. And we do have plans to expand that. We'd like to work with BC Housing and some of the nonprofits to identify places within those units where people can come and when they're injecting, they'd be under observation by staff who are trained. So although that detail wasn't there, part of the rollout of the naloxone has been to some of the agencies that staff those units. But we do need to, given those numbers, that's obviously one of the areas that we're now focusing on to really expand.
So it'd be helpful to understand too the trend line on inside versus outside deaths, because 8% outside, I read that and actually see it as potentially some success that all of the interventions that have been happening outside are making a difference, because those numbers were quite different in the 90s when there weren't these kinds of interventions. Most of the deaths were happening outside in the 90s. I
don't know if that's true. I'd have to go back and look at the data. The concern, of course, is though that if you're inside alone, no one sees you overdose.
Yes.
And so we'd like to get people out to overdose prevention sites. So what worries me is 90% are in a residence or a single room occupancy hotel. If they were in Insight or at an overdose prevention site, that would be different because we've had no deaths at those sites. So yes, in terms of the open drug use, and the Minister of Health really wanted us to get people indoors in the cold weather in December to those overdose prevention sites. That's a positive because it's obviously terrible to think about people with a chronic medical condition having to relieve their pain in a back alley or a public washroom. We want them in a place where they can be provided with the appropriate support. But our concern, of course, is that if they're indoors, the overdose is not observed and they're at very high risk of dying. Even we tell people don't inject alone. We've had reports of 2 people dying in a residence. They were injecting together and they both overdosed and died. So we really want them to be in a place where there are people who are trained who can respond. And if they're in an SRO, let's train the staff. Let's work with those organizations to see if we can find a place in those units where people can come. It's not easy because they aren't set up this way. They may not have very large numbers of staff in those units where people are trained to respond and can respond if an overdose does occur.
Okay, well, it would be helpful if it were possible to get a better trend line on the inside versus outside, because my layperson's reading of it is the investments that have gone to organizations like Van Du and frontline workers are making a difference, and why then not have those inside? If there's a case that isn't there, that would be good to understand better.
It would be good if there were fewer outside, if the deaths were going down. But our concern is that, and I think that most of the deaths have been inside, the vast majority, right from the very beginning of this crisis. But if you've got a higher percentage now inside and more people are dying, that's our concern.
Okay, well then I guess what I would hope to see is that a lot more money was going to support that the Portland Hotel Societies, the Enquiries, the people, the supportive housing providers. I think changing, I feel like I'm arguing with you, I'm sorry. I guess I would say to staff who will provide recommendations on the other 1.4 million, I feel that a strategy based on changing users' behavior is not going to be effective. We need to work with the tools we have to support users where they're at when they're using, and doing it in a way that keeps them alive.
I completely agree, and our planning going forward is that we will be providing more funding to those housing providers to help train them, provide them the kind of materials and other things they might need to do this, but I completely agree that's something the city, we would appreciate your support in doing that.
Okay, that is helpful, thank you. The other question I had for VCH, given the level of crisis in the downtown east side, all of the changes around the second generation strategy just happen to be coming in at the same time. Would you consider potentially, I think it's a lot to try and evaluate the outcomes of that strategy, knowing that this unanticipated crisis is hitting. So the Drug Users Resource Center, Gallery Gachet, other services are disappearing at the same time a massive crisis is happening. So can you speak a bit to how you're managing that and if there might be some changes in that plan?
Mm-hmm. Well, remember, there's no overall decrease in the funding for the downtown east side. It may be redeployed. For example, with the closing of the Drug Users Resource Center, we've got a new contract for a mental health and addictions drop-in to be operated by Lookout to the east of Oppenheimer Park, and that's actually the site of one of our planned supervised injection sites, and it's being run as an overdose prevention site right now. We're continuing with an overdose prevention site at the site of the former Drug Users Resource Center. So I think we can do both things at the same time. It's important to remember that the primary goal of the Downtown East Side second generation strategy is to provide integrated care in clinics, bringing together primary care, mental health, and addictions together. They were very separate siloed services, or they have been, both those delivered by Vancouver Coastal Health and our funded agencies in the past. And that's actually something we need for this response. So we need to bring together, for example, addictions and primary care, because as primary care doctors who are going to have to start managing these addictions clients, we don't have enough addictions doctors to do so. So I actually think we can layer on the response to the overdose crisis with continuing to roll out the Downtown East Side second generation strategy, and it will help in the response.
Thank you.
That's your time. Councillor Carr is next.
Yes, thanks, Mr. Mayor. Thank you so much for the report and update. I really appreciate having that regular update around what is undeniably an incredible crisis in the city. I too am looking at not what you've done, but maybe where some gaps are and concern around making sure we can sustain a response at the appropriate level in the city. So, you know, I look at the statistics, 450 deaths, 450 overdose calls in number 2 fire hall alone. I mean, I did the calculations, that's one every hour and a half that those frontline firefighters are out there dealing with it. Incredible stress. So I'm seeing the 2017 continued recommendations, and it does not include, as has already been noted by Councillor Jang, the response to support our frontline firefighters through mental health, enhanced mental health support. It's clearly in the December report, December 5th. I got a copy, enhanced mental health support with a number, 130,000. So my question is, do you need, because it's not in this report now, I'm worried that it's going to get dropped. Do you need a clear indication from council that we want you to pursue that particular line item that was in the December 5th report?
So, Mr. Chair, I very much appreciate the support from council on that item. Can certainly assure council that that is something we are actively working on with, as I mentioned previously, with the fire department, with our HR staff, with potentially some external providers as well, to make sure that we've got that program structured in a way that it's going to be optimally effective. We have implemented some short-term additional supports for Vancouver Fire and Rescue, so we are taking some immediate action. And I would expect, Council, that we will be coming back to you at our next update with some detailed recommendations around how to structure that program. But certainly hear the interest and support, and thank you for that.
Okay, so because it's not in this report, I mean, one of my considerations is should we have an amendment to this to make sure that that's clear? Are you saying that you are going to come forward with it? You do not need an amendment at this point. You are going to come forward with it.
It is actively under consideration right now, and will come forward irrespective of an amendment. So I don't believe we need that to continue that work. But I appreciate the support.
Okay.
Mr. Mayor, could I jump in? I just want to reiterate what Mr. Mokri has indicated. We are 100% committed to making that recommendation. This is the first round of recommendations today. We will shortly be coming forward with the next round of recommendations for the allocation of the remaining funding, and that will 100% be a part of it. We're just working out the details.
That's great. Thank you. Thank you, Mr. City Manager.
Thank you.
My second question is around the community policing centers, and thank you for including a new one in Strathcona. My question really is around the recognition here in this report that we have in essence a shortfall of $20,000 per every community policing center. They're doing great work and they've got added work now. I do not at all quarrel with the need to make sure they are well supported financially. My question is, to put the $20,000 in per community policing center, including the Strathcona Center, is $220,000, right? Isn't this and shouldn't this be part of our regular funding? I mean, we're talking really about covering 9 years of not doing inflationary increases. So will it be part of the next budget? Or are we going to ensure that our community policing centers are well funded going into the future?
Mr. Chair, if I may defer that question to Superintendent Davey from VPD.
Sure. Thank you for your question, Councillor Carr. That is the hope, that it becomes an ongoing budget item moving forward to address the shortfall that they're experiencing on an annual basis. The average was $20,000 plus for the Community Policing Centre's operating budget. So this would allow the Community Policing Centre to put this additional $20,000 towards rent and heat and other operational costs, and focus more towards the programming and providing services for the community within the Community Policing Centre's jurisdiction.
Right.
I could jump in just to really clearly answer your question. It will be a recommendation in the next budget to have annual increases as it should, so we don't see a stacking up of 8 years without an increase.
Right, thank you, appreciate that very much. Maybe you could just, before you sit down, and I only have a few seconds anyway, expand a little bit on really what the work of the individuals in those community policing centers to handle this particular crisis, because we know it's come out, up with concern around needles in parks and, throughout the city. So perhaps you could elaborate on that just a little.
Certainly. The volunteer base for each of the community policing centers is a mix of people who live and work in the community. It's very reflective of the community where the community policing center is located. And their mandate is to provide programming to the community based on the need. And right now the need across the city is to address the concerns related to this opioid crisis. So for example, we have increased needle patrols in various community policing neighborhoods. And as a result, we've picked up more than 1,200 needles in Granville Community Policing Center's jurisdiction. Over 400 needles were picked up in the Collingwood neighborhood. Over 700 needles were picked up in the Hastings Sunrise neighborhood, showing us that this opioid crisis is having an impact across the city. In addition, we have extra eyes and ears on the street that are identifying where people are using outside, and therefore we can divert resources to those locations, whether it's connection with our health partners to have spikes on bikes attend a particular location to ensure that users there are supported, that if they are using outside, that there's somebody nearby that does have naloxone. They can act as eyes and ears to identify where homeless are gathering, that we can therefore engage our partners at the Carnegie to do outreach and support. So there's a wide range of uses, in particular related to this opioid crisis, that we see being a tremendous benefit to the community in helping address some of the issues. And I'd like to just build on what Dr. Gustafson and Mr. Mokri said around the issue of stigma as being one of the root causes. We use our community policing center volunteers to educate. And one of those education pieces, if we can train them about having a person with lived experience share their views and their experiences about drug use, that would go a long way to having a volunteer base trained in this manner to reduce the stigma when they go out and proactively patrol, engage with businesses and residents in talking about what this crisis is all about. So that would be one step towards addressing one of the root causes.
My thanks to all the people involved.
That's your time. Thank you for the responses. Councillor DiGenova is next.
Thank you very much. I have a question first regarding consultation. I understand that when this came very suddenly, 48 hours before the budget, that staff had answered my question regarding consultation as consultation with the public would indeed be achieved, but it would be done after the fact. So I'm hoping that staff can comment on what steps you have taken to engage the public, as I've received hundreds, if not over 1,000 emails, as I know other councillors did as well, regarding a concern with affordability in Vancouver and an increase in property tax that wasn't included in the budget consultation.
So Mr. Mayor, we've, since the budget, we have not engaged in a broad public engagement exercise around this. I may ask Mary Claire, Managing Director of Social Policy, to speak to some of the outreach and interaction that she and her team are having with the community. We've certainly, in terms of the recommendations that we're putting forward today, the funding and resources for Vancouver Fire and Rescue are clearly being driven by the demand on that department, which is clear. We've clearly heard that from the department, from the staff, from our firefighters union around the need to support the department. So that's essentially the driver for that. I think in terms of the community policing center, and again, Superintendent Davey can speak to this if need be, but I know the city has heard loud and clear from residents and businesses in that neighborhood. The city manager was out in the neighborhood, I know, with the people who live and work there and heard about the need, their concern around public safety issues and the need for a community policing center. So I believe that's a piece that we've heard directly from the community on. Training, again, is an element that we've heard from the community in the downtown east side.
I'm also just, maybe to be more clear, because I have a number of questions I have to get through, and I'm more than happy to receive answers via email from staff, but this is broader consultation with all of the taxpayers because we're not concentrating the 0.5% increase to a specific area in the downtown east side. It's my understanding that it's citywide and it will affect all property owners, so I'd just like to know what consultation has been done and what is planned to be done, just as we do a robust consultation for our budget that includes our city advisory committees and the public each year. With our annual budget, I understood that that was going to happen after the fact. I remember asking the question. I was quite concerned about it in December, so I'd just be interested to have that information sent to me. I do have some more questions. Perhaps they're best answered by the VPD, but I will defer to staff regarding that. My first question is, and I suppose it goes more than the enforcement side. We've heard a lot today, and I've skipped through some of the questions that Councillor Carr asked and Councillor Jang has asked regarding mental health, but to talk about enforcement as one of the 4 pillars of harm reduction. And by enforcement, I'm not talking about the addicts themselves or people sort of in the lower level, but I'm wondering what percentage and amount of the VPD budget goes towards investigating individuals who are producing and trafficking drugs, and specifically fentanyl or carfentanil or W18 or these drugs that we're seeing have an effect.
Mm-hmm. Thank you for your question. So the Vancouver Police Department has very publicly stated we are not going after street-level drug dealers, that we are focusing instead, for lack of a better term, higher up the food chain. And we have conducted 2 very long-term and protracted projects. Tainted and Trooper are the names of the projects that were focused on those bringing fentanyl and carfentanil into the country, distributing it, some of it ending up in the downtown east side, the rest of it going elsewhere. But the projects, and I don't have the dollar figure in front of me, but the projects certainly are focus of the VPD. As far as enforcement goes, that is where our primary enforcement is happening, is at the higher drug dealer level as opposed to at the street level.
And that's the exact question I was asking. So if there's an amount that you could send to me and the amount that has been put towards the units that specifically, I suppose, focus on that higher level, that would be great. I'm also just going to put a few of my questions together. I'm happy to send the rest to staff. But regarding how many individuals have actually been charged, and when I look at 9 deaths, anywhere else in one city, if you saw 9 deaths, it would be considered homicide. It would be like serial, there would be a serial killer. And in a sense, fentanyl is. So I'm just wondering if the VPD at all has any recommendations for harsher penalties for those found with fentanyl, and have you considered or charged anyone successfully with anything like that, such as culpable homicide, or moving forward with that, with harsher penalties for those higher up the food chain?
I can certainly send you some thoughts in email, but no, we have not laid any charges with respect to somebody dealing in fentanyl that has then seen the person they've dealt to die.
Thank you very much.
Okay, and Councillor Ball is next.
Yes, thank you very much, and thank you for the report. It's very complex, just as the issue of addiction is, so I appreciate everything you're trying to deal with. My first question is a question that has come to me from mothers, and mothers whose children have died or have been on the brink of death. And the question that they say is, what are you guys doing about this stuff getting to our kids? And I don't know what our answer is. I've heard some of the things from the VPD, but how do we deal with addiction with young people? Because it's so easy to have somebody say to you, if you're down about an exam or something, here's something that'll make you feel better, and it does, and then that becomes the answer to every issue. So what are we doing about kids? How many kids have died? Because it's not clear to me whether we're gaining that data, is whether it's young people we're talking about, or are they adults? I think it's important to know, because this is every meeting I go to in a community, this is the first question I'm asked: how can you stop illegal fentanyl getting to kids? And I don't know the answer, so I'd love to, if somebody can help me here, so I can pass the answer on. Yeah. Thank you.
So, Mr. Mayor, I'll defer that question to my colleagues, but maybe just to start, I think one of the city has prioritized a number of areas that can contribute to preventing youth engaging in behavior that would lead to addiction, including the city's significant investments in childcare, early childhood education, housing, again, providing children with a safe, stable support at the start of their lives. Obviously, it's an issue that depends on a whole range of different partners and systems within society, including the education system and so on. But more specifically to your question, Superintendent Davey, I'll defer.
Thank you for your question, Councillor. The Vancouver Police Department has partnered with the Odd Squad Production Society in the production of a modular fentanyl awareness video. It will be a tool that we envision being used in schools, shown by our school liaison officers. It will be available across the province. It will be accessible online for a parent who wants to show the video to a child and have a conversation following that. It's in production now. We anticipate by May, beginning of May, to have that available to the public. So it's something that we've found lacking because this crisis has taken us by surprise as well, as far as the prevention side and being proactive. We've always done drug presentations in schools. We've always been proactive through our school liaison program in talking to kids about the use of drugs, but fentanyl is so much more dangerous than anything we've ever seen, and so we are actively producing right now something that will be available for the general public to be able to access, to have those conversations with kids.
The question I get asked from the mums and people with children whose kids have dealt with this is, why is there a dealer standing outside my school's door and nothing happening here? How can I make a difference here? Because they really do feel that kids aren't don't have the ability to make real choices. They respond to an offer, but they're not really making a choice to have a life as an addict. Mm-hmm. And almost every young person I know who is an addict says, I'm not an addict, I just use every once in a while. Mm-hmm. So how do we change that mindset of what do we do about the dealer who's standing outside the school door, and then what do you do to let people know if they're taking drugs regularly at all, they probably are an addict and need to come to an overdose place? Like, what is the answer here for them?
So if that is occurring, and our school liaison officers are very alive to drug dealing inside the school by students themselves, as well as if somebody is preying on kids outside of a school, that has to be reported to the police, and we will take action in those circumstances for sure. I mean, I just said that we don't target that street level dealer typically in our enforcement strategies, but in that circumstance, obviously the harm to society is much greater involving children, so we would take action in that case if we do receive that information. With respect to the ongoing prevention messaging and action messaging for those who are using, we are in partnership with Vancouver Coastal Health with the production of this video. It is in the early stages. I anticipate that type of messaging will be included in this video. So we are going to be able to get that message out. And again, that goes towards destigmatizing and being able to talk about it and recognizing and acknowledging that one has a problem. And that has to be targeted to our youth as well.
I really appreciate it. I'm very much aware of the wonderful work that the school liaisons do in the schools, and I know that they really do affect young people because they're good relationships that the
Councillor
kids
Ball,
look up to. So I appreciate that. But it would, thank you. Am I
that is your time.
My
Yep.
appreciation. So thank you for coming in. Thank you.
Thank you. Councillor Affleck is next.
Thank you, Mr. Mayor. Just a quick question regarding the budgets and finances that have kind of been touched on, but based on my analysis of the budgeting process that we went through in December and comments by staff, the cost that represented in the increase in budget represented about 45% of our budget increase last year for 2017, about 1.2 million, I think, or 1.7 million if you include the point. I think. Anyways, this came from comments from the city manager in November. So we're looking at almost half of our increase in our operating budget this coming year is related to the costs related to poverty, mental health, addiction, and homelessness. Now, and in the report, it talks about there's no way to anticipate the future costs in this. And I respect that Vancouver Coastal Health has stated that they're engaged and potentially covering some of our costs. I'm wondering if there's a way for the city, and we're looking at approving some extra costs, or approving this week. Is there a way for us to create a predictability of the costs for the city, knowing now what we're going through and what we've put our money into so far and what we're putting our money into community policing? Is there a way to create a ratio or somehow to predict the future, depending on if it gets worse or if it gets better? Is there any way to create a predictability to this for the city in our roles and responsibilities?
So, Mr. Chair, it's a very good question. I think certainly now what we've gained over the past year, is experience with this crisis and the impact that it's having. I think the challenge I would have in answering your question is the significant exacerbation over the last couple of months of last year. So I'm not sure we're at a point yet where we could say that it's stabilized and we'd be able to use, for example, this month or the first quarter of this year as a proxy going forward. Certainly that's one of the things that we're going to be looking at very closely this year, is what is the trajectory of this crisis and the impact on the city, specifically our response. I think that's an item that certainly is something we can report back to you as we come forward on this item over the course of the next few months. What we're seeing this year, I know some of the data that I saw just this morning from Vancouver Fire and Rescue is that calls to Vancouver Fire are actually up even more in January, to the tune of 25% over last January. So I think at this point in time, we're potentially still on an upward trajectory, and we'll have to watch that over the year to see whether it does stabilize and then what kind of assumptions we can make from that. So my expectation would be certainly by the time we get into the 2018 budget process, we'll have a much better handle than we did in 2016, having now a full more year of experience on that.
There's a great deal of things we're doing are infrastructure related, putting in electrical and the community policing, and these are things that we can manage and should be embedded in our budget. If there was a way to figure out, hopefully that, hopefully it doesn't get worse, it goes the other way. But that would be very helpful for us, I think, for managing our costs. Councillor DiGenova kind of touched on this, but in the report on page 2, it states that, and this is maybe for the police, the VPD, I think, I'm not sure, that we are in a crisis, that the word contamination of the illicit drug supply, and I find that word scary, and there are questions that we're getting as councillors, and I think we're hearing these questions. There are two questions. One is, why would drug dealers contaminate their own supply to their customers, their people that they sell to, and so why would they do that? And then the second question, if the word contamination, it sounds potentially nefarious. Is this potentially something that is intentional? And are the police investigating that possibility that this, given the neighborhood that this significant impact is having, are you investigating that as a potential, how horrible that would be? But those are certainly questions we're getting as councillors, as elected officials.
And Councillor, that's an excellent topic to raise, because it is something at the forefront of our investigations, as well as to ensure that there's any indication that there is any intent in this. My understanding of why fentanyl has contaminated, for lack of a better term, the drug market is fentanyl it's about 100% stronger than heroin. And in speaking with heroin opioid users, their high is much more intense with the use of fentanyl. So someone who is stepping on heroin, so mixing heroin with fentanyl, a drug producer at the higher level in the food chain, is going to put in, based on a guess in some cases, an amount of fentanyl that will create a much more significant high in order to generate that interest in that product in a particular market. so for their traditional users. So what's happening is this mix is sometimes not accurate, and many times probably not accurate, and is resulting in death, because it's not intentional, but the user is, the dealer is trying to create more of a client base because this particular product is better than the next guy down the block. It creates a better high. So that's the philosophy behind it. They're not getting the science right, and we're seeing deaths. My understanding is that the equivalent of 2 grains of salt of fentanyl can kill someone. So we're talking about microscopic amounts of fentanyl going into a heroin dose to create that greater high. And it's not an exact science in the basement of someone's house. So that's where, the support for what Dr. Daly is talking about in obviously, through the prescription of synthetic heroin, they know exactly what is going into that dose, and therefore it is obviously safer than buying it illicitly.
And the second part
Okay.
of my question?
Quickly.
The second part of my question regarding whether or not this is intentional.
Yes, so we have no evidence to indicate that any of the investigations that we've conducted so far that shows that there's any intent on the part of any of the dealers or producers in killing off their client base.
Okay, Councillor Stevenson. Last councillor with questions.
Thanks very much. Actually, I think I'd like to speak to Mary Claire on this. First, thanks, of course, as everyone else has said, for this really difficult report, and one that obviously none of us really ever thought we'd be dealing with, certainly not in the scale that we have. But my concern is around a bit the same as Councillor Affleck, around how this has landed so much on us and our taxpayers and our concerns. And I'm in agreement with the route we're taking right now, but I'm really disturbed that the province doesn't seem to be doing a lot more. And they have a surplus, $2 billion surplus. That's not a small amount of money. I can tell you when I was in the provincial government, we had nothing near. We were struggling just to get a balanced budget and finally put it into law. But now there's $2 billion and we have this enormous crisis. And a lot of it that I'm encountering has to do with people's attitudes when they show resistance to putting money in. I think back to the 1960s when I first started to hear about marijuana, and I was in my very early 20s, and we thought that, oh, people who smoked marijuana were, dirty old men in alleys, and heroin is even worse, and so on. And it took a long time for those attitudinal changes to happen. I think we really have to go out and deal with the public in some kind of large PR campaign, which can only happen if we get the province to get more involved. And then that will, I think, over a period of time, change the attitude of the public and the whole way we look at that. And I think I heard Dr. Daly yesterday on CBC saying, we want to look at legalizing these things, but the atmosphere in the public is nowhere near that right now, and we need to concentrate on that. So can you comment more about what's happening with the provincial government and why they're totally seemingly throwing up their hands and saying, you guys go at it in Vancouver? Particularly with an election coming on, you would think that this is something they'd be keen to help out with.
I'll try my best to respond.
That was a sermon, by the way. Question at the end.
Mary Claire Zach, Managing Director, Social Policy, so through the chair. I'll answer the last part of your question first, I think. The whole issue around stigma has really blocked progress all along, and right from prohibition around alcohol, and we can go back even farther than what you mentioned. So the one thing I do want to say is that Vancouver Coastal Health and other partners are very interested in working with us around a broader public education kind of campaign. And we haven't nailed down exactly what that's going to look like, but we feel that it is very, very necessary that we do that. And I would suggest not just in Vancouver, but it has to be across the province and actually across the country. Because of the issues that we're dealing with. So we're in discussion phases around that. And so we'll be getting back to you and coming back to council with a plan in the next update, hopefully around what that could look like, or one shortly thereafter. We realize that that's a very, very important thing that we have to address. And we're addressing that not alone, but together with our provincial partners. And the youth education piece is also a very important part of that. I just wanted to mention also working with young people and their parents, potential of looking at the current SAUCE program that it really involves parents, it really involves young people, and around combating issues around addiction and mental health issues, all kinds of things. So when it comes to the bigger picture around the province and their what they have in terms of their surplus. One of the things I know that has been talked about is the potential of whether or not we could be looking at something like an urban agreement for Vancouver. Could they be a partner?
To do that, we've got to get provincial money, and there is $2 billion in surplus. So I hope that this election, all those who are fighting for positions, will be reminding people like the Attorney General here, who's a Vancouver seat, that we need some of that $2 billion in order to fight this issue.
We absolutely do. And with it, we'll do better.
Okay, thanks, Councillor Stevenson. And that is all the questions. So we have voted to refer this to hear from speakers tomorrow. We'll hear that at committee before council tomorrow. I just wanted to, first of all, thank all of the staff and the key people from Vancouver Coastal Health for being here and for all of the amazing work you're doing on the front lines to grapple with this. This is a terrible tragedy here in Vancouver, across BC, and it is now starting to affect the whole country. And what we do here in Vancouver is obviously going to be critical to the response that happens everywhere else. So we're being watched very closely, and given the experience and the passion, not only in this room, but throughout the community, with our first responders, with people working in the healthcare system, with so many community volunteers, obviously we have great dedication and energy to do our best with this, but it's taking an absolutely horrific toll right now in the community. I wanted to thank Dr. Kerry Jang and his colleagues, I know, who helped put together these next steps and work with staff to make sure we have some international best practice recommendations. I know that provincially and federally, there's a real need to see some very clear, concrete and immediate actions. And I think the work done by many of the experts here in Vancouver who have lifetimes of experience is going to be essential. So appreciate the work that's gone into putting those recommendations and beyond, as Dr. Daly said, beyond the immediate response to just to keep people alive with harm reduction, these actions to deal with recovery and treatment, substitution therapy, and help people to heal rather than just try to keep them alive to the next possible fatality. I think we have to get on to those solutions as urgently as possible, particularly given the spike that we're seeing right now. So thanks to all those working for the solutions, and that's and to get the data so we understand exactly what's going on the ground. So thanks very much for being here, and we'll look forward to more regular updates to council given the massive significance of this and the impact it's having on our city. Thanks for being here today, and we'll be back on this tomorrow with speakers at committee. Okay, we're going to move on now to our second report reference, and that is on the City of Reconciliation and Canada 150 plus. Councillors, we're on the edge of quorum here. We've got We've got 6 now. We're okay. So we're going to dive into our next report reference on City of Reconciliation, Canada 150. Wendy Au, who is our Assistant City Manager, is here, as well as Ginger Gosnell-Myers, the Manager of Aboriginal Relations, and Marg Specht, our Director of Social Projects, are here to present. And before we move to hearing the presentation, we have a request to speak to this staff report, which is the Financial and Operations Update on Vancouver Commemorates Canada 150 Plus. So should Council wish to hear the speaker tomorrow, we can refer that to hearing the speaker. Councillor Stevenson will move that. Councillor Carr will second that. Any debate? All those in favor? Any opposed? And that carries. So we'll hear the speakers to that tomorrow at committee. And today we will hear the presentation from the team and have some questions. Thanks for being here. Ms. Au.
Hey, good morning, Mayor and Council. Happy New Year. I guess it's a good beginning. We're going to bring some good news to Council. We're here to provide Council with a progress report on the work that the city departments did in 2016 in response to the TRC recommendations and also furthering the city's goal to become a city of reconciliation. Ginger Gosnell-Myers, our Aboriginal Relations Manager, will speak to the progress as well as all the learnings over the year, the challenges and the opportunities. The second part of our presentation is on the Canada 150 Plus program. As a City of Reconciliation, our commemoration of Canada 150 Plus will focus on showcasing Indigenous arts and culture with the theme of strengthening our relations and moving forward together. Marg Specht, Project Director for Canada 150 Plus, will take you through the exciting events that are being planned throughout the year. So Ginger, you want to start first?
Thank you, Wendy. So we have had the designation of being a City of Reconciliation for a little over 2 years now. And so we do get a lot of questions from time to time from other municipalities and community groups as to what it is that we're doing and if there's any knowledge that we can provide to them as they move forward in their reconciliation efforts and their relationship building with local First Nations and the urban Aboriginal community. And so we looked at this report as an opportunity to really focus on our learnings. So the first part of my presentation is going to focus on the progress that we have had to date as a City of Reconciliation within our work plan. And then the second part is going to focus in on the learnings that we've had. The development of our City of Reconciliation framework is being maintained and being built upon through discussions of our Interdepartmental Reconciliation Working Group and also our First Nations Coordination Group. These are two separate staff working groups within the city. One focuses on our relationships with Musqueam, Squamish, and Tsleil-Waututh First Nations. The other focuses on our reconciliation work plans. It is invaluable that we gather our staff together to talk as a group and formulate what our next steps of action are and our learnings. I think the majority of our success as a City of Reconciliation to date has been from staff willingness to learn and grow and evolve and to experiment. We have had, through our reconciliation framework, 3 longer-term goals. And a lot of our work in our departmental work plans is really summarized and collated under these 3 longer-term goals. These are things that are easy for staff to really build upon. We've had a lot of success with turning these goals into actions within our work plans. Some of the examples of how we've been able to build upon our first City of Reconciliation long-term goal, which is strengthening local First Nations and urban Aboriginal relations, has been, for example, the city supporting the Metro Vancouver Aboriginal Executive Housing Calls to Action report, which was presented last January. The city did commit to building up to 700 units of housing for the Aboriginal community, and this is going to focus on housing for Aboriginal families, for Aboriginal young people, for students, for young people in care, for elders caring for families. And so this is really going to fill a much needed gap that we see within our affordable housing needs in the city. Two of our major projects that we're supporting are building a new Urban Native Youth Association Native Youth Center and building in partnership with the Vancouver Aboriginal Friendship Center Society, building a new friendship center for the growing urban Aboriginal population that we have here in the city. Recently, as you know, we've undertaken plans to develop a joint sea level rise plan for Vancouver. We are going to be partnering with Musqueam and ensuring that we work together in supporting our communities together with this effort. And of course, as you see in the picture here, this was last June. We see the mayor with Chief Campbell. We hosted a West Coast Family Night for National Aboriginal Day, and we've seen over 600 members of the Aboriginal community, well, all Vancouverites, join in celebration for Aboriginal culture, to feast, to sing, to just celebrate ourselves as a community. And the feedback from the night was pretty extraordinary because we've had a tradition of holding West Coast Family Nights for decades. And we haven't had a magnitude, we haven't seen these numbers in a long, long time. So it was really heartening to see the level of interest from the urban Aboriginal community for the city hosting a West Coast Family Night. We are the first non-First Nation to host West Coast Family Night. And we did, it was fun. So we do see examples of building the City of Reconciliation framework within our departmental work plans. This is reaching across all of our departments. We're not seeing, a conglomeration of projects within one department more than others. What we're seeing is an uptake across the board, which is really encouraging to see. Our second long-term goal is promoting Aboriginal people's arts, culture, awareness, and understanding. And some of the examples that we've partaken in this past year is supporting the installation of the Survivors Totem Pole in Pigeon Park. You see Scundall Bernie Williams blessing the pole before it was raised. It was a very important effort for the downtown Eastside community and ensuring that we do see Aboriginal culture reflected in the downtown east side, and we do support efforts for the community to rally upon in a healthy, in a community way, in a cultural way, and in a healing way. We also ensured that when we hosted the Readdress Housing Summit a couple of months ago, that we looked at Indigenous design within housing projects around the world. And this created probably one of our more exciting next steps that we'll be building upon, and that is taken from a workshop that we held to explore Indigenous design principles for city building. What we're finding from Indigenous architects from across the world is that they're looking at the development of Indigenous design principles to help guide their city in their planning, and not just their architecture, but in goals for how we can better plan neighborhoods that reflect Indigenous culture, so that we can reflect Indigenous culture within our architecture, within how we tell stories of the land, within how we connect with local First Nations, and eventually how all members of that community can connect with Indigenous people's culture. Because we don't just see Indigenous peoples being moving forward and connecting with their history and building upon their culture here in Canada. We see Indigenous peoples really striving for this regeneration all over the world. And so we're seeing some unique examples, some best practices that the city can grasp upon. As well, as Marg is going to talk about, we do have a really extraordinary plan for our Canada 150 Plus celebrations this year. And you will be hearing within the Mayor's Task Force on Mental Health and Addiction report to Council in February, update on research that we've been conducting on Aboriginal healing and wellness in the downtown east side. And this really connects to the report that you just heard on what it is that we can do to ensure that there are new and innovative ways to support people who are living with addictions, who are living with mental illness, and how we can use culture as a protective factor. The third long-term goal is incorporating First Nations and urban Aboriginal perspectives for effective city services. A lot of this is done through a cultural competency training, which I'll get to in the next slide. But a big aspect of this is ensuring that we have Aboriginal people within our city staff teams. And you see a number of examples where departments have really looked at their work plans, looked at some of the gaps, looked at some of their goals, and identified new staff positions to ensure that they can meet those goals and they can fill those gaps. The Vancouver Public Library has formed an interlibrary reconciliation committee, really building upon the model that we have here in City Hall, where they bring in staff from all of the libraries to talk about their reconciliation efforts. We're recruiting Indigenous staff with planning, policy, and cultural knowledge across the board in engineering, in communication, in arts and culture, within our park board, and within social policy. So our team really is growing, and this is really encouraging to see. It gives us an opportunity to learn that much more. And this is helping us apply a reconciliation lens on our council priorities. And what we've seen is that there have been other positive results that have emerged and have enabled the city to further our efforts. We did collect an overview of where we are in meeting our truth and reconciliation calls to action. As you remember, last January, we identified 41 actions that we can move forward on that will help us implement the TRC calls to action. There were 41 of them. And so we do have a list within Appendix A of the Council report. Very quickly, we have completed 12 of those actions. There are 10 that are still in progress. It'll take a little while longer in order to complete these. And then there are 19 that are just ongoing. These are going to be long-term, ongoing efforts that we will take on a regular basis. And so, as I mentioned earlier, a lot of this report focused on what have we learned, and formulating this to look at some of the questions we've been getting on how we've been doing. So the remainder will focus on our learnings to date, especially, and this slide is going to talk a little bit about what have we gone through in our attempts to really become a city of reconciliation. And I think the first step that we took is the willingness to experiment, the willingness to embrace a concept that we don't know very well, and to acknowledge that there is no existing blueprint or clear roadmap to guide staff in undertaking this work and experience. So let's be open about what it is that we have to embrace and include in our work plan. Experimentation has been a huge aspect of our success. The second is acknowledgement of the history of residential schools and the impact of harm from the loss of land, culture, as well as many years of oppression from the Indigenous community. The next step in our process to date is really about relationship building. So taking those learnings, ensuring that we have a strong focus on our relationships with Reconciliation Canada, with Musqueam, Squamish, and Tsleil-Waututh First Nations, as well as the urban Aboriginal community, mainly focusing on our relationship with the Metro Vancouver Aboriginal Executive Council. Recognition has been an important aspect. Recognition in learning about how local First Nations and urban Aboriginal communities want to be recognized. First Nations want to be recognized as governments, and that's why we have a government-to-government relationship with Musqueam, Squamish, and Tsleil-Waututh, and to ensure that we work to respect and represent the matters that come forward. Cultural competency has been huge, as well as ensuring that the cultural learnings that we have as a city can be translated into creating access. So city staff working to ensure that Aboriginal Vancouverites are included in the scope of services and opportunities offered to all. And we will continue to build on our process to date of becoming a city of reconciliation. And of course, capacity building is key. And so last year we came to you with the goal of providing cultural competency training to 350 city staff. And what we've done is we've actually doubled that. So we have over 700 city staff in the last year that have participated in cultural competency training. This includes senior staff, including our city manager, general managers, and even a member of Vancouver City Council who kickstarted our first cultural competency training. And the feedback from this training has been very positive and has been identified as having an impact in the work that they are undertaking. And we have had many requests for more sessions. Staff want to know more. What can you do with the learning that you've just had? And so we're working on enhancing our training so that staff can continue to build upon the knowledge that we're sharing with them. And the other aspect of capacity building is that the learning is going both ways. So when we're working with local First Nations, when we're working with the urban Aboriginal community, we find that we're also learning about First Nations governance firsthand. We're working about how the urban Aboriginal community works to address their priorities firsthand. And in turn, First Nations and urban Aboriginal Vancouverites are learning about how the city operates. This has been a clear gap that we've had with the city and First Nations and urban Aboriginal communities. We don't see we hadn't seen a clear understanding of how the city operates, how we formulate our policies, even the supports that we can give. And now we're seeing that this is translating back and forth. And so the learnings are going both ways. There have been some challenges. There have been some learnings and there have been some opportunities. The first is really focusing on the opportunities, and that is reconciliation has provided us an opportunity to be innovative. We see some examples here of naming our first civic building in an Indigenous Hulkaminam language, the Nasamat Strathcona Library Branch. We also see the Britannia Carving Pavilion at the Britannia Community Centre, and then we have a shot of our Readdress Indigenous Summit panel. And this has been possibly the most positive change that our reconciliation efforts have provided for staff. And the more that we work to embed reconciliation within our work plans, the more we're going to identify Vancouver as a unique place on earth, the more that we're going to ensure that Indigenous voices and ideas are included in the work that we bring forward. And this is going to change a lot of, it's going to enhance our efforts overall. And there have been some constraints that we faced. We recognize that we are in a process of learning and doing and growing and evolving from our experiences. Not everything has worked. We recognize that maybe the city can't be a leader in everything reconciliation. And some of the key learnings that we've had to date is that we need to be flexible in our timeframes and recognize that First Nations and urban Aboriginal agencies have significant demands on their limited resources, resources that they're using to support the Aboriginal community. And we're just going to have to be patient and flexible and maybe hold back on our plans somewhat to ensure that their voices are included. We also recognize that there needs to be different engagement approaches between working with First Nations and urban Aboriginal communities. We can't work with First Nations and urban Aboriginal communities the same way. First Nations are governments, urban Aboriginal communities are residents. We need to have different approaches, and if we don't, we can't cookie cutter our way into innovation and solution and supports. I think an interesting constraint is we have to know when we can set a precedent with a new approach. It's really difficult to understand when we can do something new. We have a lot of thoughtful discussions in our interdepartmental working groups about when we should experiment, when we should take some thoughtful risks. And finally, In order to ensure that reconciliation is embedded in our work plans, we also have to keep our eyes on the longer term goal, and that is socioeconomic well-being for Aboriginal communities. And the reality is that the impacts on socioeconomic well-being does require federal and provincial collaboration. We can't do this on our own. Reconciliation will be achieved when we see those standards within our First Nations communities. And so you might remember this, it was a little while ago, but when we held our Reconciliation Summit in 2013, we did Wordles. This was the Wordle that came forward. It looks like a paddle. And the story was that this is fitting because we're actually paddling together. You see the representation of the canoes and the paddling in the panels behind you, and you will hear about how that's being included in the work that we're doing for Canada 150. So it's fitting that this be the final slide for our City of Reconciliation update. We have really, in the last few years, engaged in so many activities that will help us learn about the impacts of residential schools. And this has meaningfully changed the city as an institution and as a community of staff. Things are happening differently. Things are happening in a much better, well-rounded way. And this is going to make Vancouver a stronger city where all residents, especially Indigenous peoples, feel welcome, supported, and included. And the more we indigenize, the more we identify Vancouver as a unique place on Earth. And the more we indigenize our urban environment, the more we are presented with unique opportunities to be our best selves. And what we're seeing is that a City of Reconciliation does benefit all. So I'm going to pass this over to Mark Specht, who is going to talk about some of the work that we're doing, some of the plans underway for Canada 150 Plus celebrations, and then we'll take your questions. So Mark.
Thank you. Good morning. So just to refresh your memory, in the fall of 2015, we did 3 community consultations, including one with the Urban Aboriginal Peoples Advisory Committee. What we heard from the community is that they didn't want to celebrate 150 years of colonial rule, but they did want to hear stories from the people that live here, and specifically those that were here long before 1867. We also heard from Mayor and Council in January of 2016 that as the City of Reconciliation, the work we do in 2017 to commemorate Canada's sesquicentennial should focus on reconciliation and, wherever possible, directly address the calls to action from the TRC. Vancouver's Strengthening Our Relations project will use Canada's 150th anniversary as an opportunity and a time for Indigenous recognition and celebration with all Vancouverites. The Canada 150 tag, with the tag of moving forward together, will reflect Canada and Vancouver's many cultures and peoples who've come together to learn, share, and connect through an array of cultural activities. And the plus is meant to point to the culture on the land that predates contact and confederation, and at the same time, a nod to the future that the next 150 years will be a time to share a peaceful and respectful future. So before I walk you through the projects that we're doing, I'm going to show you a little video, I hope. There you go. So this was meant as a little tourism tag video, and shorter versions of that will be seen throughout our social media. We'll also create quite a few other videos that will be embedded on our website when it's launched in March, including some videos directly from the nations. So this is our brand. Last fall, we put a call out to the three nations specifically for an artist to design our logo that would support our vision. And this is the logo that we received that was selected from all those submissions. It's by Thomas Cannell, and you just saw an animated version of the people in that that forms the logo. And he deliberately, in his artist statement, which you may or may not be able to read there, he talks about his deliberate use of a variety of sizes and cultures to represent the many people all over the world that will be coming to Vancouver that include children and of different race. At the center of our activities is a 9-day festival called the Drum is Calling Festival from July 22nd to 30th. It will be an interactive programming experience of contemporary and traditional cultures, cross-cultural performances, arts, crafts, sport, fashion, feasts, music, and multimedia. The location will be Larwell Park, and it's which is at the center of the Vancouver's downtown cultural district. So oftentimes called the cultural precinct, but we prefer to use district. One of the highlights of the site will be an installation called Kanata, created by Vancouver Native Housing, and it is meant to represent 6 different types of dwelling, traditional Aboriginal dwelling from across Canada. It will start construction in June, and then we will build our site around it in July, middle of July. On New Year's Eve, when we used that video and we announced our intentions for the plans for 2017, we also, and it was an opportunity for us to acknowledge and give space for the Department of Canadian Heritage to acknowledge the significant funds that they have given to all of these projects. We also announced that Crystal Shawanda would be one of our headliners, and we also announced that our opening headliner would be Buffy St. Marie, and if you may or may not know, but she has just announced to receive the Humanitarian Award at the Junos this year in Ottawa. So this is an early rendering of our site. This is Larwell Park. It's, as you know, a parking lot most of the time, but it has been used for very large gatherings. It was one of the live sites during the Olympics. It was used as Grey Cup celebrations a couple times, and then most recently as a fan zone for the Women's World Cup. It's a great site because of its proximity to transit and it's accessible, being flat. And this is the footprint of the cultural district or precinct that I just referred to. And it really extends to include the civic theaters, the QET Plaza, the central branch of the public library, and Larwell Park, which, as you know, is the future home of the Vancouver Art Gallery. And the intention is for us to try to connect these spaces so that audiences and people that want to share in this experience will come down and move from site to site and extend their visiting time there. We will use specifically at the QET Theatre and Plaza, we will use the Playhouse Theatre for some a film series, some speaker series, and some performances. We'll also use the Plaza for some carving demonstrations and hopefully a long table dinner. The QET lobby will be used for an Indigenous Fashion Week, which will last for the last 4 days of the festival. Also, the last 4 days of the festival, we're going to close Canby Street from Georgia, about halfway down the block, and use that as sports activation and it will encourage flow between those spaces. The second large endeavor that we're taking on, specifically myself and my team, is a gathering of canoes, and it will likely be staged at Jericho. But there's a lot in discussion right now about the exact location and the exact date. So best to say that we will do it. We're just not sure exactly the dates. But it will be for us to support the 3 nations they're hosting, and we're providing the support to them. And the gathering will include cultural sharing, feasting for the canoe families and their supporters. And then the third one is a walk for reconciliation. We're partnering with Reconciliation Canada in producing this walk, and it won't be on the viaducts as you see in that picture from 2013, but rather at the newly opened, across the newly opened Broad Street Bridge from Sunset to Vanier. So while the work that you're doing, those 3 projects that I just described, really don't leave a physical legacy, we wanted to leave some kind of a legacy, and we really felt that an Aboriginal production apprentice program could do that in a different way, a different kind of legacy. So this program will be open to people who self-identify as Musqueam, Squamish, Tsleil-Waututh, Urban Aboriginals, Inuit, or Métis. There'll be an open call issued in a month or so, and this will not be a free apprentice program, but rather a living wage paid program. They'll start in May and with safety training and a variety of safety trainings and first aid, and then they'll move into job placement for a few weeks, and then before they come and actually work as crew on the site. The festival is the Drum is Calling Festival. And it's really for individuals who want to either change their career or get experience, really good hands-on experience in theater, film, concert, special event industries. It's not just for young people. If there's adults who are wanting to change careers, it's open to them too. Now I'm going to tell you about a number of other projects that are part of the work that we're doing. And what I've described now and what I'm going to describe right here are all part of what is funded by Canadian Heritage. There's a couple of other things I'll mention later that aren't funded through Heritage. And for all of these events here, staff from the Park Board and Library are present and can answer any questions about the individual projects that you might have. So I'll just very briefly, I'll just say that the Walk Vancouver is with the Parks Board, and they are it's a mobile app with a 150-kilometer walking challenge. The Wild Salmon Caravan is a celebration of the end of the salmon's long journey along the Fraser River. And there's 2 youth-directed projects on immigration and anti-racism. Cultural Services through Public Art will be launching a mural program that will focus on Indigenous recognition and participation. The Thunderbird sharing ceremony, which is actually the photo that you're seeing right there, is with Ariosa Dance and the Eagle Song dancers, and the other 2 nations will participate as well. It's an aerial piece that will happen somewhere in July in one of the parks, Lakely Stanley Park, and then during our festival, towards the end of July, we'll move into the atrium of the Vancouver Public Library. Also, through social policy, the Vancouver Immigration Partnership will create another event much like the Dialogues and Convening Project in 2012. There's a number of other significant events that we didn't solicit and came to us not directly for funding but for acknowledgement, and we will acknowledge those throughout the year if they fit with our theme. And just for an example, one of those events is an event in the Push Festival by a company called Black Arm Band, and the show is called Dirt Song. And we'll invest in that show by buying tickets, a large clump of tickets, and seeing that they're distributed through Metro Vancouver Aboriginal Executive Committee. And then, of course, the Talkie Stick Festival. Those two events I just mentioned happen in February, but later in the year there's other events, Children of God by Urban Inc. and Missing Women by City Opera. So this is Uninterrupted is an event that has come to us. It will happen in 2017, but not funded through Heritage. We will support it, but the city will support it through other means. And it happens under the kind of guidelines of the Cultural Tourism Policy, which Council endorsed in 2008. It's a projection depicting the journey of wild salmon in BC rivers that was created specifically to be projected on the underspan of the Cambie Bridge from Cooper's Park heading south towards Spyglass Place. There's no narration, and there will be an original soundscape that will accompany it. Uninterrupted is 30 minutes long, and it will run 5 nights a week for 3 months from the middle of June to the middle of September. The second project or event that will be happening this summer that falls under the guidelines of the Cultural Tourism Strategy is Nomadic Tempest. The City of Vancouver will present this production by Caravan Stage Company, both epic and allegorical, an all-ages circus spectacular, in the play that shares the perilous journey of refugees. The stage itself, the theater, is a 100-foot-long tall ship called the Amerizi, and it will be moored in southeast Falls Creek. As you can see from this rendering, the audience will sit on the shore on the bleachers and will, by doing so, create a kind of a purpose-built amphitheater. There will be 18 performances over a 3-week period ending on Labor Day weekend, and all performances will be free to the public. It will overlap with Uninterrupted, and on those days, the start times will be coordinated so that an audience could actually see both events in one evening. Oops. So here's our budget. We received $2.313 million from the Department of Canadian Heritage through the Canada 150 Fund. That's the third largest award in that program across Canada behind Montreal and Ottawa. And it supports almost all the programming except those last 2 events that I showed you. The City of Vancouver in total has committed $2.4 million as matching funds to the Canadian Heritage contribution. We expect to be able to raise $1.5 million in cash and in kind through sponsorship. That brings our total expenses to about $6.2 million. This is roughly what these events will cost. The festival will be roughly $2 million. The canoe gathering, $400,000. The walk, $200,000 to $300,000. The variety of programs that I described from the park board and the library, about $1.2 million. And then the external partnerships, that includes those 2 last big events, outdoor events that I mentioned, is about $300,000. And then staff marketing and contingency, just over $2 million. So just in closing, the City of Reconciliation, as the City of Reconciliation, these projects, it's our goal to create awareness through cultural interaction. We're using this opportunity of Canada's 150th anniversary for Indigenous recognition and celebration for all Vancouverites. And we feel that strengthening relations between Vancouver First Nations, urban Aboriginals, and Métis communities through arts and culture will really build a strong community. Our goal is to create an accessible opportunities for all Vancouverites and visitors to learn and connect and celebrate. And it's really the only way we can move forward together in hope and healing.
I'd like to just add one quick point. That is like throughout the festival, there will be lots of opportunity for city staff to be engaged, to get involved, and we'll be recruiting staff as volunteers. But I'm also working with our management team to look at when staff are volunteering, maybe recognizing one of their volunteer day as a cultural competency training experience day. It will be similar to what we did in 2013 for staff participating in the TRC event. So it will be very exciting, and staff will get an opportunity to really experience about cultural competency.
Thank you very much for the presentations on City of Reconciliation and Canada 150 Plus. Lots of info there. Really appreciate the work to bring it all here to Council. And we have referred the second item and the speakers to the second item to tomorrow's committee meeting, tomorrow morning at our committee meeting. We have 3 people with questions. I'm not sure if those are if they're 150 plus, which is tomorrow's item. We can do that tomorrow. So maybe, first of all, we're going to need a motion to extend to complete the meeting. Councillor Deal, and a seconder for that. Councillor Stevenson, all those in favor of extension, any opposed? And that carries. We recess at noon, typically here. Let me just see if there are any questions specific to City of Reconciliation. We can do those, and then we're done with that piece. And 150 plus we bring back tomorrow. And then we can recess in a few minutes here until 2 p.m. to finish the balance of the council meeting agenda. So are there questions on, Councillor Reimer, did you have a question on City of Reconciliation?
I do, and in respect to the time, I would ask 2 of them, and a written memo or something would be totally appropriate. One, I wouldn't mind a verbal answer to. The 2 that I'm fine for written, I'm very curious about the recommendation number 66 related to the Reconciliation Fund that might be available to community members. Well, now I'm guessing what it might be. So if I could get some written information about the timeline for that and what it might entail, that would be fantastic. And also curious on the progress with the Aboriginal Health and Wellness Center in the downtown east side, not not a new item, but in context of the report we just heard on the opioid crisis, especially important to be talking about what the next steps there are. The one that I would love to hear your reflections on, I noted VPL really, I mean, right after City of Vancouver, the Vancouver Public Library is the hero of this report on reconciliation and action. And it stands in contrast somewhat to Park Board and BPD and some of our other agencies. And I'm trying to get a sense of, is that because that's the reality, or is it a reporting issue that we're not getting the information from BPD and Park Board and others about the activities that they're engaged in? Sorry, and I'm using acronyms all over the place here. The VPD, the Vancouver Police Department, and Vancouver Park Board versus the Vancouver Public Library's activities.
Right. So this report, we wanted it to focus not so much on, like, here are the larger list of things that we're working on. They are reflected in the actual report themselves. So you can find details on the projects that the Reconciliation Fund has funded for the last year. And we're working on projects for 2017 with that fund as well. It's not open to it's not a grant, so it's not a community grant that groups can apply for. It's a fund that is used to supplement the work that city staff are already engaging in that need extra supports in order to carry it through, in order to ensure that either they can meet one of the TRC calls to action or that they can embed City of Reconciliation goals within their work plan. The Aboriginal Healing and Wellness Center update, we're working on that for the February 22nd report to council update. So there have been quite a number of activities that we've been doing in the last couple of years. So you'll see details of that in February, if that's okay.
That's great. Yeah.
Can I jump in too?
Yeah, for sure.
I want to make sure I'm explicit in responding to your comment about BPD and Park Board. And Park Board, as you know, brought in an archaeologist and has for several years been working, for probably been working with the First Nations groups around Stanley Park. And so I guess both VPD and Park Board have been, from my perspective, real leaders in pushing this. And actually, we've been learning from Park Board around the archaeologist and the role that they're playing. And so I guess I'd say, I think the way that it's reflected in this report, as Ginger has indicated, you don't see all of the activity that they've been undertaking, which have been pretty significant.
Okay, I was guessing that was the answer, but I did want to say that in public because I know I've seen significant actions from all those agencies that are equally impressive to what's seen in this report.
Yeah, absolutely. I think their absence from this report isn't reflective of them not working on this. In fact, they are, and Park Board does have their own collection of how the Park Board has responded to and is implementing the TRC calls to action. They're going through a 360 review of their Park Board activities to ensure that reconciliation is embedded in the work that they're doing, and so they have their own report that they're working on at this point to provide a larger update on what they've been doing and what they plan to do.
So I'll just take a small liberty here to say that our questions, because we have this limited time and there is a procedure, tend to focus on challenges and missing, but I did want to note how extraordinarily proud I am of the work that you do on this. When I go out in the community and to other cities, there really is, sorry, the context, somehow we always conflate, like we get opioid or some incredible crisis and then also this issue, and I find it hard to sort of dislocate the two. But really, the extraordinary change in trajectory as a result of the work that you're doing, not just here in Vancouver, but across Canada, is palatable and very noted by communities. I mean, understanding there's so much more work to do, but you have to start that journey somewhere, and it takes a lot of courage and a tremendous amount of effort. So I wanted to acknowledge that work by you and other staff.
Thank you, Councillor Reimer. Very well said. Councillor Deal.
Thank you very much. Also reflect the amazing respect and gift of this work that's being done. My question on this piece of the work is number 67 around the museum policies, and that can be answered in a short memo. I just wanted to find out what we're doing. We have, as you know, especially I would say the Museum of Vancouver probably has some significant items in their collections that we need to address appropriately, and so I'll be looking forward to when we have some more information on that piece of it, to getting a short memo from staff on what we're doing and what the process will be. Thank you.
Thanks, Councillor Deal. Councillor Carr?
Yes, thanks. One of my questions I will ask tomorrow, but just to give you a heads up, I'm very interested in the cultural competency training and noted that there is an opportunity for that, and I'm really very curious about the kind of outcomes. It might be hard to describe, but I'd like to know something about that. That can be done tomorrow. And my only other question is I'm so impressed by the breadth of activities, but if you could say, there is this one thing we've undertaken that has really made the most phenomenal impact, what would you say that was?
Besides designating Vancouver as a city of reconciliation and our year of reconciliation, which are really extraordinary because I don't think municipalities were viewed as a place for leadership in furthering First Nations relationships, I would have to say the cultural competency. It's amazing how important it is for staff to have this knowledge. And when we take the training, we sit down, we learn about the impacts of government policy for the last 150 years, actually beyond that, and how this brings clarity to staff and their work plans and understanding the issues that Aboriginal people are dealing with, on a historical level and also a contemporary level. This is an understanding and a learning that they haven't been afforded going through the school system. And if they had had an opportunity to learn, it's because they took that step to learn. And so we're seeing staff take action. They're making a choice to learn more because this is valuable to them, because they want to see how they can embed reconciliation. That in itself is an extraordinary action. They don't have to, but they are. The fact that we've doubled our baseline of 350 staff to over 700 staff, many have been park board and police department and library staff, just shows the level of commitment. And you can't build upon something like a City of Reconciliation if you don't have staff in place that can carry this through. And I think that's probably the disconnect that we see with other levels of government, maybe not being able to further the level of impact that they want. It's my own personal opinion, but it's really our staff learning and willingness.
Thank you.
Okay, thanks, Councillor Carr. And that is all for questions. So huge thanks to staff for the great work done. And I think Councillor Reimer expressed it so well. We have 150 plus questions and some answers coming back tomorrow morning at our committee meeting, and that means we are recessed for lunch break, and in camera council will meet, and we will be back here at 2 o'clock. Does that work, City Manager? We'll start in camera at 12:30, and 2 o'clock we'll be back here in council to complete our agenda. Thanks, everyone. Okay, we're ready to get started here. Apologies for the little delay getting started again on our council agenda. Welcome back to our council meeting today. And we left off after 2 report references on the fentanyl opioid overdose crisis and the City of Reconciliation. And we're on to our 3rd report reference, which is on our the Independent Election Task Force. And Shoni Field, the chair of the task force, is here to present. But first, we're going to hear from Rosemary Hagiwara, who's our Director of Business and Election Services. Welcome.
Thank you, Mr. Mayor. You've taken my introduction, so I won't go into it. Shoni Field is the chair for the Independent Election Task Force, and she's presenting the recommendations from the task force. Ms. Field is available to answer questions after the presentation. And should council have any questions for staff, we would be happy to gather them and report back in the form of a memo at a later date. Thank you, Ms. Field.
Welcome, Ms. Field.
Thank you. Thank you very much for having me here today. Just before I get started, I'd like to introduce some of my fellow members of the task force who are here with me today. Maybe if you can stand up. Hilary Farson, Mark Friesen, Anthony Hodgson, Robert Mattis, Helena Sefferling, and also Diana Bully, who facilitated for us. So thank you for joining me here. So as the chair of the Independent Election Task Force, it's my great pleasure to present our final report to you. And looking over the work we've done over the past 6-7 months, realize that the central theme really is emphasizing that more choice and flexibility of how municipalities such as Vancouver manage their elections is critical for increasing public confidence and voter engagement. And I would like to point out before I get into the body of the presentation that it was very important for our members that we really appreciated the appointment as independent members and did not discuss or assess partisan ramifications of our recommendations at all. So it was very much focused on that piece of increasing public confidence and voter engagement. Take a second to master the slides here. So just a quick review of what our terms of reference were when we were set up. We were to recommend changes to council concerning the delivery of municipal elections in the City of Vancouver that would lead to improved public confidence and increased voter engagement, specifically with voter turnout as a specific measure. And we were to look at specific council directives that looked at campaign finance, proportional voting, anonymous balloting data, online voting pilots, and some of the priorities coming out of the Engaged City Task Force and Healthy City strategy around positive cues and voter registration, permanent residence, and feedback from positive cues that have been working. Several elements of our recommendations could and should be implemented before the 2018 civic election due to limited costs and/or ease of implementation, while others may take longer and may not be able to be implemented until the 2022 election. The identification, as I go through identifying some recommendations as quick wins, in no way should compromise or delay work on others that are identified as higher priority, simply that they do come, they would be easier to implement. Also, as many of the directives in our terms of reference require a change to the Vancouver Charter, and prior requests to the province to do so have not met with success, our work really centered on building a case and public engagement around these directives that we feel were essential for protecting and strengthening our democracy. Also, in summary, in order to move forward all of these critical actions, we did recommend that the city designate a dedicated elections advocacy staff position to advance those that did require charter changes, as there would be significant intergovernmental work. So I've mentioned already the charter. We, when we first convened, spent some time looking at the legislation and that formed the background of our work to understand how it fit in within the Vancouver Charter, the School Act, the Local Elections Campaign Financing Act, and look at where the city has abilities to shape election process through bylaws. We also looked at the Engaged City Task Force, of which some of the recommendations formed part of our directives, and looked at the past history in these directive areas around working with the provincial government for requests to change the Vancouver Charter. I've already introduced the members that are here today. There were 12 of us appointed, and we worked closely with city staff and an independent facilitator. And we started working in June and worked through to October, working in specifically small groups taking on key strategic areas, doing a lot of work outside those formal meetings and coming back with draft recommendations and work in that area, which we'd then discuss with a larger group and identify ways we were planning on moving forward. Within our terms of reference, a goal of increasing voter turnout was identified because we felt that most measures we were looking at had the potential to incrementally increase voter turnout, and that voter turnout was not the only measure of electoral health and public confidence and voter engagement. We did choose to expand upon that and have a larger list of 6 considerations that we use to guide our evaluation and recommendations around implementations of our key strategic areas. Most of them are self-explanatory, but just to expand a little on political equality, we were looking at where participation in the process is not limited by ethnicity, geographic location, political affiliation, gender, sexual orientation, etc. Within those list of 6, we do identify voter turnout as one of the 6 considerations that would guide our evaluation. We did also note that there are some measures that would improve public confidence and voter engagement and may improve the overall number of voters, but may not increase the voter turnout, which is usually measured as a percentage of registered voters, so that there would be some need to look at metrics of success that took that into account. So when we worked through our areas that we were looking at, we met in the fall and looked at the sort of fleshed out recommendations and then worked as a group to prioritize our list of recommendations. And I should point out here that the top 2, adopt a proportional voting system and reform campaign finance, were significantly favored by the group as having the most impact on increasing engagement. And then when we get to our third priority, increasing eligible voters and voter turnout, there are a number of measures in that which I will break down. So we get to looking at adopting a proportional voting system. I'll try and go into a very brief touch on the sort of why, although you will, for each area, you will find more of our reasoning and deliberative processes in the report. So in looking at our current at-large block voting system, we saw that it did not embody the key democratic principles that all voters should be treated equally and are equally deserving of effective representation. And so in that way, we felt it contributed to a lack of citizen engagement and public confidence in the electoral process. We then noted that other voting systems, collectively known as proportional representation voting systems, did better embody that principle of equality and can positively impact voter turnout. So our recommendation is that we would use a deliberative participatory process, for example, in specific a citizens' assembly model, to produce a model of PR voting best suited for use in Vancouver's municipal elections. This could be modeled on the BC Citizens Assembly or on the Grandview Woodlands Community Plan Citizens Assembly. And we've provided guidelines in the report as to assembly composition. And that Assembly's mandate would be to recommend a model of PR voting that best addresses Vancouver residents' top democratic values. In arriving at those values, we suggest a significant engagement process with citizens of Vancouver to determine what important considerations would be in helping to choose a new voting system. We specified some 6 in our report. For example, how important is it that parties gain seats in proportion to the number of votes cast for them? How important is it that whether the voting system encourages candidates, elected officials to seek common ground with other candidates, elected officials within and across party lines? How important it is that whether the voting system encourages diversity amongst candidates from parties? How important is it the degree to which strategic voting is allowed, enabled, or encouraged versus whether voters are encouraged to vote directly for their actual preference? How important is it to you whether voters can hold individual candidates directly accountable when voting? And how important is it whether independent and party-affiliated candidates are treated equally on the ballot? We would suggest that any additions to this list should focus on values rather than the mechanics of the electoral system, and consideration of the mechanics would be the work of the Assembly. Assembly members would then learn about proportional systems, design models of their preferred systems, evaluate and select a model based on how well it meets those values determined by Vancouver citizens. And that structure should allow room for learning, public input, and deliberation, specifically a preliminary report and means to solicit feedback and accommodate that feedback. Once the Assembly had made this recommendation, the City would request that the provincial government allow the City to adopt the proportional representation model. And should the government grant that, then it could move forward with implementing the new system for the 2022 municipal election. Should the provincial government not grant the City of Vancouver's request, Vancouver could choose to further investigate semi-proportional models that may be able to be compatible with the ballot marking requirements of the Charter, but further research to compatibility would be required there. And prior to the first election, we would recommend that the City of Vancouver should undertake an extensive public education campaign, and after 2 election cycles, that the City of Vancouver would implement a formal review process aimed at refining the system. What we identified as the second priority is in reforming campaign finance. We saw that participating in the decision-making process after receiving contributions creates a perception of bias or conflict of interest that undermines public confidence in the electoral system. And our job was to look at means to increase public confidence and voter engagement. And you can see the impact when you look at research that there can be a tie between these contributions and how competitive the municipal elections are, and that turnout in elections that are more competitive is higher. I want to emphasize here that we were focused on the perception of conflict, and we're not suggesting any violation of current law or policy. To that end, although our research found examples from various parties over past and present administrations, inclusion of specific examples was meant to be illustrative and was not meant to indicate that one party or another or independents were more or less engaged. And although we note that the perception of conflict is often more publicly expressed towards a majority party as they have more control over decision making, at the time, acceptance of those donations is problematic for councillors from all parties and independents. So we really want to congratulate City Council here on their commitment to moving forward on this issue. And we recommend in the long term to reinvigorate efforts to advocate for Vancouver Charter amendments. And this could look at adding a question on local election financing on the next municipal ballot because there is strong public support for initiatives in this area. And prior to that vote, of course, undertaking a robust education campaign to inform residents about issues related to that, and putting forward a clear package of proposed election financing reforms. This may include a ban on campaign contributions from unions, corporations, nonprofit societies, associations, anonymous donors, and donors from outside of Canada. It should include a limit on the annual amount of contributions by individuals and on third-party advertising, real-time disclosure of campaign contributions, and a lobbyist registry. Note that in other jurisdictions where concern has been expressed about election funding after campaign finance reform, attention has been put in public subsidies, matching, and our tax credits have been explored. Those, of course, have budget implications and in some cases would require working with other levels of government, but just flagging them that they would need to be explored. The city could also encourage municipalities in Metro Vancouver and across BC to include a similar question on election financing, although of course we recognize that campaign financing in Vancouver is significantly different from smaller municipalities. Could also continue to submit resolutions to UBCM calling on other municipalities to move forward on this area and taking the ballot results in Vancouver to the province in a submission. Do feel here that there is potential for a short-term solution with the long-term goal, of course, being changed to the Vancouver Charter. Understanding that there is commitment amongst council to banning corporate and union donations, we put forward a proposal around amending the City of Vancouver Code of Conduct for council officials. So this would be introducing a provision requiring elected officials to withdraw from the decision-making process in matters submitted to City Council from corporations, unions, nonprofit societies, etc. This would require all submissions before Vancouver City Council to indicate whether the applicants, either the applying entity or in the case of an organization, also its officers, had made contributions and if so, to whom. While this code of conduct is not binding, in the absence of a provincially legislated ban, changes to the code of conduct would reflect City Council's unwavering commitment to this ban, and failure to adhere would come at a political cost. It should be noted that while challenges in managing transgressions around this code can easily become the focus, the intent here is not to create a climate of constant withdrawals from votes, but instead to incentivize parties and candidates to adopt gift acceptance policies that prohibit these campaign contributions. And at the same time also provide a disincentive for those entities who bring matters before council for decision from donating. So yes, we could imagine a circumstance where you'd all accepted a donation from a corporation or a union, and you'd all have to recuse yourself from a vote, and where would that leave the city? However, that would only happen if you had all consciously chosen not to honor the intent of this proposed change to the Code of Conduct. So given that Council had asked us to find a way to do this, we assume that the political will is there, and we'd prefer to focus on the changes, these incentives and disincentives that would provide around these donations. Our third area looked at mechanisms to increase eligible voters and voter turnout. And there's a number within here, and obviously in here the connection to our intent of increasing public confidence and voter engagement through voter turnout is very clear. Should be noted that all but one of these do not require charter changes. So unlike the previous two, they are things that council can move on more quickly. Have gone too far forward, I think. So our recommendations here are meant to complement and build upon the strategies the city employed in 2014, saw an increase in turnout, and we're not recommending at all to replace that. Would encourage the continuation of those practices and the expansion of them. So in the first area, we looked specifically at investing in additional election outreach resources, and there were three primary recommendations within this section. To increase funding for the Plan Your Vote tool and other elections education collateral, so it is disseminated more widely. To increase outreach staff and capacity to develop partnerships, to deploy these Plan Your Vote tools and education collaterals, and to fund a social media team to engage voters leading up to the 2018 election. And this was after a review of the literature around best practices and finding that much that had been done was consistent with those best practices and could be expanded upon. And that is something that could be done as a quick win before the next election. We also are recommending creating and implementing post-election polling. And this is to better understand the degree to which different voter engagement tactics and tools are effective in getting people out to vote. We're recommending it changing slightly from the Engaged City Task Force that was looking at ballot questions or exit polling, looking at post-election polling, because we'd like to measure non-voters, reach non-voters as well as voters, and see what's dissuading people from voting. So this would allow us to determine what of those measures in 2014 and what of the subsequent measures are successful more specifically, rather than just having a general idea that we did a pile of stuff and some of it worked because we've seen improved voter turnout. This would also help us understand the demographic composition of voting patterns to better understand which communities' specific tools work better than others. Put down my papers and are missing my next chart. Next area is around extending voter rights to permanent citizens, permanent residents, recognizing that this is a first step to becoming a Canadian citizen, that we are looking at the intrinsic equality of all members of our community, and recognizing that permanent residents in Vancouver are active members of the city and their communities and contributing to Vancouver. So here we're looking at requesting that the provincial government make legislative changes to the Vancouver Charter to allow permanent residents of Vancouver to vote in municipal elections. And again, this is a charter change, so we're recognizing that there needs to be creation of public awareness and engagement for dialogue around this issue, raising of support for it, and undertaking consultation with public and affected stakeholders. We also wanted to note here that that in requesting the change and investigating the logistics of implementing that change, that because permanent residents are not part of the voters list, we'd need to look at collaborating with the provincial government or ICBC or other bodies whose data collection mandates do include permanent residents. And this is one of those areas where we want to note that while the number of voters will increase, we do not know what the impact will be on voter turnout. And so we would want metrics of success to acknowledge that and look at that rather than a straight measurement of voter turnout. Our next area is looking specifically at targeting voter registration practices and requesting that Elections BC adopt new voter registration practices. This would be in support of specifically in support of the Chief Electoral Officer from the Elections BC October 2014 report on the recommendation to pre-register 16-year-olds. And we can see research-wise a clear tie between registration and likelihood of participating in the first election and in subsequent elections. We also would like to include in that request request to keep email addresses and options to register mobile phones, as our abilities to reach out to voters for the purpose of sending voting information is not necessarily in line with how people are choosing to get information. Looking at research around increasing positive voting cues, the research here all highlights the importance of social networks in voting participation and activating those social networks. And Vancouver has a number of civic organizations and nonprofits working in this area with a high level of trust amongst their target audiences. So we looked at 2 points. One, creating citizen academies to increase civic capacity. And this would look on building on the City of Vancouver's 2014 Youth Politic Program to reactivate that as a citizen education and leadership development tool. This would take in specifically, we'd look at targeting it to community leaders from underrepresented Vancouver communities building that general awareness of the functions of the municipality and the knowledge of the electoral process, and then following each semester putting a process in place so each mentee would in turn run a civic academy in their community informed by the knowledge they'd gained. In our next area, which we've also identified as a quick win that could be done in time for the next election, is to create and administer grants for civic groups to hold voter education campaigns, registration campaigns, get out the vote campaigns, and celebration events. Specifically, we're looking at targeting groups whose audience is speaking to low voter turnout, and specifically that they would be nonpartisan. Our fourth recommendation is also a quick win. This is looking at making anonymous balloting data available in open data format. Many other jurisdictions are using that use ballots with multiple marks are openly publishing their data, anonymized data, for the purpose of learning more about the electoral process. And it would help all involved in Vancouver elections to better understand voting patterns, to identify what tools work to increase voter engagement, where more work needs to be done around understanding of the process, and could also help motivate reform of the current voting system. This area in the past in the Vancouver Charter requires for the physical ballots to be destroyed, and so in the past this may not have always been possible without a charter change. However, we have identified that the voting machine vendors can now report on detailed anonymized ballot information, so the city simply needs to include that in their RFP for the next election to have the ability to store and receive complete ballot data, to be able to, and then direct staff to make that available in open data format. So this is a fairly low cost, low administration way of really helping to increase our understanding of how people are using our system. The last area is around conducting an online voting pilot, and I just want to flag here that this was really the only area within our task force mandate where there was significant debate and disagreement over where we wanted to go. And we were struggling to balance two considerations, with some members emphasizing the need to pursue online voting to improve accessibility, and other members emphasizing that online voting should only be pursued with full independent and expert-led security analysis. We do know that online voting has been successfully implemented in a number of municipalities across Canada, in Ontario and Nova Scotia, and several jurisdictions outside of Canada. And a survey conducted in 2016 found that online voting through a secure website was the top election reform wanted by Canadians. There is reasonable evidence that it can increase accessibility and convenience to voters and has some potential to decrease costs. However, studies looking at the relationship between online voting and voter turnout have shown null, small, or negative effects. This is an area where the Government of British Columbia has turned down requests to allow BC municipalities to implement this technology, and an independent panel on internet voting established by the province recommended against implementing it universally. The panel did recommend that if online voting were to be implemented in any way, for example for a pilot, that the province should set up a committee of independent technical experts. That that committee has not yet been struck, so should the city choose to move forward in this area, the first step would be to call on the province to set up that committee. There is potential for other activity in working through UBCM and with other municipalities to encourage them to also press for these changes should the city wish to, and to continue to monitor the experiences of municipalities across the country and share those experiences with the technical committee and any body that is looking into this issue. And again, this area would require a charter change. So I identified working through where there were some areas where we thought could be recommended in time for the 2018 election. due to limited costs and limited administrative needs, and it could be done so without compromising or delaying work on top priorities. So just quickly to review them, the amending the city bylaw around the code of conduct to include the provision to avoid the appearance of conflict of interest around corporate and union donations, to invest additional resources in expanding upon the employment of best practices at elections, to implement post-election polling, to create and administer grants for civic groups that are working on voter education campaigns, registration, get out the vote campaigns and celebration events, and to make the anonymous balloting data available in open data format. We really felt in looking at these areas that it was essential for our democratic health to move forward, that Vancouver did need this ability to be flexible to respond to the specific needs of our jurisdiction in growing public confidence and voter engagement. In our final report, there's more background on the history, the key issues, our discussions, our detailed recommendations, some implementation plans with approximate timelines and costing, although we will caution on costing because we weren't embedded in the city budgeting process that extra work would need to be done on this area, that these were very initial estimates. And in conclusion, before we turn to questions, just really want to thank Council for giving us this opportunity. I think in identifying that we need to do work on public confidence and voter engagement, an essential first step is by tasking citizens to be involved in that process. And it's both the why we want to do it and the how we do it. By being engaged in our process to getting more engagement, we're along the right path. And we really thank you for putting forward this task force and appreciated the opportunity. So thank you.
All right, thank you very much for a great presentation summarizing the work in your final report, and a huge thanks to all of you and those members of the task force who aren't here today. Big thanks on to them as well for all the work done right through the summer and fall to bring this forward to Council, and we greatly appreciate it. And we're going to start with questions from Council. I've got Councillor Reimer first. Come on.
Thanks very much for the, it's hard to give thanks for something that involved such a broad amount of work and effort, but to say that having sat in on other task force, I can only imagine the challenges of this one, but this one was necessarily independent, so I will guess at how much work you put into it, and thank you for that. So I have, I think, a few questions for staff, and then I'm going to go back to you because I want to understand the nature of their report back so that I'm asking questions appropriately. So as with other task force, my understanding is staff will take our questions today should we have them, but we'll report. It was your intention in any event to report back on the recommendations, the legalities of them, and the practical, how they might be implemented.
That's correct.
Okay, so one need not then ask about existing recommendations. It would only be if we had additional, okay. So the one thing I would ask that isn't, it's alluded to, and Ms. Field even alluded to it in her closing remarks, is around the date of that report back, because there are some critical timing. If campaign finance reform, which is one that I'm particularly keen to see legislated by the province, what the latest date they would have to legislate it is for us to practically enforce it for the 2018 election.
I believe in the report in November of this year is the deadline for Council, but staff could prepare a response to questions that Council might have before summer.
Okay, so we would have the opportunity to get the response. Okay, that's fantastic. Thank you. So the rest of my questions are for the committee. Thanks. So first question, this is, as near as we could tell, the first time in Canada a municipality has set up any sort of, because we're not given an independent body like Elections BC or Election Canada. So this was the best we could do within the legislative constraints we have from the province. So I'm interested to know what the efficacy of it is from your perspective. Like, was it a useful exercise? Is it something worth doing after every election?
We certainly have found that the mandate was broad, and if we had, there were the list of things that we could not get to that we felt were related simply because of the time constraints was long. And so I think there certainly is value in having a citizen process, a public health checkup on the state of our elections.
Okay, that's great. And well, okay, that probably leads a bit into my second question then. You had a three-part mandate, one of which was to look at these advocacy issues that the report focuses on, but the other two, the surveying of candidates, not about necessarily how they felt about the advocacy items, but their general experience in the election, as well as recommendations to review whether the allocation of resources from council is sufficient to meet expectations in an election. I note that those aren't as focused on in the report. So was that a lack of time and resources to do that, or a lack of necessity to do that?
I think that in terms of the allocation of resources, that rolled into our priority 3, because a lot of that was around where we saw the need to further support what was happening right now. Around talking to engagement with past candidates, we did do an email survey as had been specified and got, I think, a really good quality of feedback back. We would recommend in a future process that it be flagged that there is the wish to engage with past candidates, but not necessarily define what mechanism, because if we'd had time, we would have, or were not specified that it needed to be as a survey form, we would possibly have done it in a public panel format or one-on-one, more one-on-one meetings where we could dig deeper. And so I think that's a restriction where it would be good to have a bit more flexibility.
Okay, no, it's helpful to know. I mean, it was an effort to try and do this like health checkup within constraints, but we're kind of flying. It's a catch-22. Without what you tell us, we don't really know how to reason. So it's helpful to sort of tease out those important points. On pro-rep, I have to admit I was a bit surprised given the long history of quite emotional debate around wards versus at-large, the usual electoral reform debate, that you kind of blew right past that and recommended pro-rep as an answer and also a citizens' assembly as it. So if you could flesh that out a bit more, as well as it'd be helpful to know how many of you, I know you were very involved in Citizens Assembly for STV, how many of you have been involved in past processes around pro-rep and Citizens Assembly?
I think of the panel, 2 of us, myself and Tony Hodgson, have been involved in the issue in the past actively. When we, wards in the sort of history of looking at Vancouver voting choices is always going to be part of the investigation, but we didn't feel it met what the intention of this task force was, which was to improve public confidence and voter engagement, specifically by looking at increasing voter turnout. And so while districts across Vancouver could maybe a mechanism, if paired with some sort of proportional voting model, it's the wards in themselves wouldn't necessarily deliver in those improvements, that areas that council had identified they wanted improvements by. And we should caution that once you start breaking it up too far and have, if you're only electing 1 or 2 in each ward or district, then you cannot deliver on proportionality, which does have some research ties to increased voter turnout.
Okay, I appreciate the explanation on it. Thank you, and all your work.
Okay, next questions come from Councillor Carr.
Thanks, Mr. Mayor. My thanks too to all the members of the task force for the work. I'm sure it was a considerable amount of work. My first questions, however, are to Ms. Hagawara. And I'm just looking at the process of how we are going to get questions to you. I have some questions now written out. Do you want those emailed to you, or what is the process for us supplying you with questions that could come back in a staff report?
Thank you, Councillor Carr. We would be okay accepting the questions now on the floor so that the rest of the councillors are aware, and our panels as well, so we can gather them.
Okay, well, I'll do that. I don't expect the answers, but My first, well, first of all, I am interested in your evaluation of all the recommendations. I hate to say that to you, but it would be good to know how you feel about them all, and particularly which recommendations align with what the city is currently undertaking and staff is currently undertaking after our review of the last election and our ongoing efforts to increase voter turnout and voter participation. Secondly, I'd like to know, although thank you very much, Ms. Field, for relaying which recommendations are within the purview of the city and which are the purview of the province. Just an affirmation of that. In other words, what can we control? What is that list of recommendations that would require charter changes? Third, what is the process for the city to change our code of conduct? I have a hard time thinking, I mean, I love that recommendation, but to change the code of conduct by council itself seems like a little bit of a conflict of interest in and of itself. So I'd like to know what that process is. And particularly, what are the repercussions for breaking the code of conduct? Fourth, is there precedence, and is it even legal for council to say that it will, in advance of a committee supply or a task force or a citizens assembly providing us with a report, to say that we are going to implement it? What are our obligations to do further public consultation and to assure ourselves that we are meeting public interest in that particular decision? Actually, those are my general ones. I have some specific ones for thank you. So to Ms. Field, thank you, and to the task force. In terms of discussing campaign finance reform and changing the code of conduct, did you talk about whether you would require no donations of any amounts, for example, from a developer to a political party or or individual councillors that would then trigger the need to recuse herself?
So there is sort of scales of gray within that, which council could do further work on. I think our specific areas was looking at what damages public confidence and voter engagement, and the perception that things are controlled by big donations from corporations or unions is what's doing that damage, that perception of it. So whether that damage is lessened by people knowing, well, that limit is $1,000 or $5,000 or a limit on or not is really hard to gauge.
So there was no determination.
There was some discussion, but no determination.
Okay. In terms of the setting up of a citizens assembly as a mechanism to determine a potential proportional voting system, alternative voting system, I have two questions. One is, it would be, the models would be based on an assessment of public values. And you've listed a number of areas that you would see questioning. Did you at all discuss the fact that there is already a certain, let's say, public, I don't want to use the word bias, but there's a lot of concern that citizens have expressed around political parties and the role of political parties. Our city has political parties, many in BC don't. So did you discuss how, a question that you might pose that says, do you want to see a fair representation in line, so a party gets a certain percentage of vote, then it would have that share of seats. But if people don't like political parties, how does that figure out in terms of the values?
Yeah, we did also address the need that we would want citizens to be evaluating how important it is that there's not a sort of systematic bias on how the ballot presents them towards independents or parties, that they would be treated evenly in that way. And so I think seeing how highly that value would rank would give some indication when evaluating systems, whether one is more inclined to look towards something that that would prioritize party role more or less. So it's tricky.
I have more questions, but I am out of time. So
You are out of time. Thank you, Councillor Carr. Councillor Affleck is next.
Thank you, Mr. Mayor. Thank you, Ms. Field, and thanks to the task force for all your time. We really appreciate it. It's good information for us to have. Just a couple of questions. One regarding a lot of the report talks about empowering the City of Vancouver, allowing us to oversee the elections, in the charter and how we do our process and funding and all those things. And I'm just wondering, as well as the administration, currently we administer the election campaign ourselves with our staff. They're seconded to do the work. I'm wondering if the task force looked at the other side, saying perhaps the city shouldn't be overseeing it, and that perhaps creates a conflict, not only with our staffing, that perhaps Election BC should oversee our election campaigns, and not only in Vancouver, but potentially other cities, that might be a better process, distancing our staff from the process, as well as the whole decision-making process of potentially giving the power to council, which is political all the time, no matter whether you have parties or not. We are politicians, and empowering us to change at any given time how an election campaign might operate potentially puts the opportunity in the hands of any party that might be in power at any given time to change the rules to their favor because they control the decision-making in the City of Vancouver. Did the task force look at all at the other side of the spectrum as far as taking away some of the power?
So it did come up in discussion. A lot of, because of our limits of time, we made the decision not to spend a significant amount of time for things that were not specifically within our mandate. One of the, we looked at it specifically around management of voting lists, of if we're expanding it to permanent residents, how that would look like, of moving more stuff to the province or having Vancouver's own voting list. We didn't make significant determinations there. I think throughout all our work there was the recognition that Vancouver, because of its size and budget, is significantly different from other municipalities in BC, and there are some advantages to being able to have some choice and flexibility. I would, and this is a personal reflection, not of the task force, but obviously in terms of expanding efforts around election stuff, there would need to be some sort of distance of what, once resources are allocated, that it operates at a distance from political staff.
Okay. You go into a lot of detail about election financing. I think all of the parties here that are represented in this have supported election finance reform, capping donations, all those things. The one thing I didn't notice in the report, for example, Vision Vancouver received around in the last election, around $320,000 from unions, 1.4 million from corporations. That was during 2014 they received that money. So we know what they got in that 1 year for the election campaign. They won the election. They didn't win the popular vote, just so you know, and on council. MPA actually got more votes, so first past the post worked against my party on that in that situation. I'm just wondering though, we don't know what Vision Vancouver, for example, the party who controls the agenda here at City Hall, they control the vote, and we don't know what they're receiving in between elections. So they received over $300,000 from unions in 2014, 1.4 million from corporations, and yet I have no idea what they received in 2015, 2016, and now 2017. How come that is not reflected in the report?
So I would imagine that looking at the significant amount of funds that both major parties received during the election campaigns from corporations and unions, that I would see that same trend playing out in the years between elections.
Not if you're not in power, I can tell you that.
And there is certainly the opportunity there to expand that to have tracking of donations at all times. That would be certainly in the spirit of what we recommended. It would come with more administrative work around reporting of donations. But clearly the issue of the perception of conflict is there in non-election years as well.
So you're recommending potentially that should be, transparency is a key.
That transparency, should the resources allow, could certainly be expanded to cover the years in between elections.
All right,
not just within the campaign.
Okay, thank you. I'm out of time. Thank
That's your time. Thank you. Councillor Ball next.
Yes, I just had a few questions and also a very deep thank you. Citizen Task Force work extraordinarily hard and at the end come in and get a whole bunch of questions. So that's not the fun part of it. But I really appreciate all the work you've done and for coming to talk to us yesterday. And thank you to everyone who's here from the committee. I know how much work this is and appreciate it, so thank you. I was wondering whether you had had time as a committee to look at why some of the decisions had been made over time, say in Vancouver and British Columbia, or even throughout the world, in terms of decisions of how voting is conducted in various cities, and looking at our history of why. For instance, in Greece, you know, you actually could vote if you owned property. Why couldn't someone else? It was the same here. That's what it was like originally. So why? And how did those things affect voting throughout? Because I really appreciate you trying to expand the number of people who will vote, and how do we base what the responsibility is for we know that people who own something will probably want to vote because they care what happens to their neighborhood and their investment, but how do we make sure other people feel like they have an investment and a responsibility even if they're not landowners? Because that's what our original votes were based on, who owned land in a city. So how do we go from there to be able to expand that to everybody wanting to feel responsible for their city by coming and voting? And that's what I'm interested in. What's the advantage for people in voting in terms of how you talk to people or want to get people involved?
So in terms of the history, I sort of look at the evolution of voting about being how many people do we have to let in to avoid a revolution at any one stage? I mean, you start with absolute monarchs, and then you let in the titled aristocracy, and then you let in landowning men, and you keep on, and you keep adding. You add women, and you add different minorities, and you move beyond landowners to say, well, you know, renters in Vancouver sure have an opinion. And so look at it as a real evolution. We're at the stage now where we're getting close to a sort of perfect franchise but there are some significant steps that we identified in the report that still need to be done. I think over my past sort of 13 years of working on electoral reform issues, the main thing I hear from voters is they don't vote because they don't feel they can make a difference. And so a lot of the recommendations we were looking at, whether it's saying a voting system that makes it easier to see how your vote accurately translates to electing someone, or a finance system, a campaign finance system where you're saying my interests are not supplanted by someone with deeper pockets. I think a lot of those reforms are suggested around the idea of people feeling like their vote makes a difference.
So you think that's the major feeling for people, that if they feel that their vote will actually get the person in that they want, that is the major feeling about why you'd go and vote?
Not even necessarily just getting the person in that they want, but that they would see that the issues that are important to them are brought forward in between elections. If they have something that has come up, they have someone they feel they can call and say, hey, how come we have a housing crisis in Vancouver, and what can we do, or what should we do? I want to hear what's being done about the fentanyl crisis. And so that feeling of connection, that the issues that they care about are being worked on at a municipal level. So I think it's that they can make a difference and that they're seeing their ideals reflected in the work is anecdotally what I have heard from people.
In terms of permanent residents, we used to, and I've been in Vancouver a long time, so we used to hear a lot of complaints about, oh, you extend the vote to permanent residents who aren't actually citizens and members of the community that way. They're not paying federal tax. What are you talking about when you say permanent residents? Because I don't think that translates to the general public of knowing what that means.
Sure.
Because
And
we used to get a lot of complaints about having people come here, not know anything about the city and then voting. And what you do want is people coming here, getting involved in voting, and how do you make that happen? So they aren't afraid, because usually a lot of our people come from other countries where being on a list of any kind was a terrifying object. And I have had a number of friends who came from Europe who didn't want to be on any list because they thought maybe somebody could find them and that would be dangerous to them. So I understand that. But how do we make that not a negative thing for permanent residents? Because once they're on a list, they're on the list for everybody. And I'm just wondering, how do we make that a welcoming thing rather than a frightening thing?
I think that recommendation around permanent residency is very important when taken in concert with the increasing positive voting cues, for example, around the creating citizen academies within specific communities to help that education piece, and the creating and administering grants with civic groups, because you often have people who are new to the city who have more of a relationship of trust with a civic group that represents them. And I think those would be really important pieces to increasing that trust and participation there.
So those groups would act as ambassadors, that's what you're
Yeah, both through engaging their community leaders in those citizen academies and in giving out grants to those organizations to run registration campaigns. If you're new and distrustful, having having the person at the center you go to say, hey, you should register to vote and here's why, is far more compelling than having to seek it out yourself or to go to somewhere official to do it.
Okay, that is your time, Councillor Ball. Thank you.
Did you ever do any requirements? Sorry.
I'm sorry, you're way over time, Councillor Ball. Councillor DiGenova is next.
Thank you very much. I have a question regarding page 21 of the report that talks about reform campaign financing, and looking at one of the first points on the page, a ban on campaign contributions from unions, corporations, nonprofit societies, associations, anonymous donors, and sources outside Canada. Now, I'm just wondering if there was any further discussion. So, for example, a reporter came to me and showed me campaign donations to a political party that ran in the municipal election that actually happens to have the majority on Vancouver City Council, where there were 3 $2,500 donations made from marijuana dispensaries. Marijuana is still currently illegal in our country, so I'm just wondering if illegal operations or illegal substances or any vendor of that had been considered in this report, I suppose, because of the way it could be linked to certain organizations or group or crime.
We were looking at a much larger context of the impact on engagement and citizen trust of organizational donations overall, so we did not specifically look at any specific industries.
Okay, thank you very much. Another question I have is regarding the online voting and trying to engage, I suppose, different or more people and trying to increase voter turnout. I don't know if we'd call it turnout if it was online. However, I'm wondering if the committee considered the recommendations after a vote at LMLGA regarding, I know that there was a motion brought forward against online voting, as there was concern that it could be compromised. In fact, that security and technology just isn't advanced enough to make sure that there wouldn't be any tampering with that. If you could comment on that as well.
As I said, this was the most contentious area we discussed. And I think the reason why we ended up at the recommendation we did was the understanding that anything further would have to go through that independent technical committee who would be
considering those security issues and not recommend it to go further in light of those. Certainly amongst security experts, the opinion is currently that it cannot be fully secure. We don't, in the pace of technological change, we don't know what the next, 3 years, 5 years, 10 years will bring. And so for those who felt that it was an important tool to increase accessibility, it was important to continue investigating in that area. And for those that security was a primary concern, it was important that full, independent, expert-led security assessments be part of that process.
Okay, so to clarify, right now that's not in the recommendations, that online voting is something that should be moved forward with until that.
It's that these steps, if the steps if council was interested in moving it forward, are far from the point of being able to launch a pilot, and it is in working with the province and in calling on them to establish that independent committee. And without that in place, the prerequisites for considering it any further aren't there. And that piece would have, I would imagine, a significant security assessment as one of its key points.
Thank you. Another question is regarding, I mean, right in the previous election, we had a number of polling stations where the public could go out and cast their ballot. We had advanced voting, and I understand that there was also a mail-in ballot for those individuals who perhaps had a disability. For senior citizens, or for, I suppose, individuals, and I'm not saying all senior citizens have mobility issues, but I certainly have served as a liaison to the Seniors Advisory Committee before, and I'm currently the liaison to the Persons with Disabilities Advisory Committee. And people who either are below a certain income may not have access to the internet or may not be versed in the internet. So how would they get that information? I mean, I understand that cards are mailed out, but was there anything, I just didn't see anything specific in the report talking about those two groups and making sure that they get out to vote?
I think there were, and I think that would be found, although not specifically noted, comes under the sort of, we'd like to see an expansion of the activities that happened in 2014. I know, for example, the expansion of advanced voting, what was seen as a positive, although anecdotally, I have had people say to me, oh, you're on the election task force. Can you tell them that there was not enough polling stations for advanced voting? And in my neighborhood of X, it was really difficult for me. So I know that there's still work to be done in those areas, and we would encourage more work in those areas, building on what has been done.
Great, thank you very much.
Okay, next and finally back to Councillor Reimer.
Thanks, Mayor Robertson. I just wanted to move the motion, which would be the receipt for information. I also wanted to add that council discharge the task force so that you don't feel bound to, your mandate has been completed, and to offer our thanks for completing the task force work. And also directing staff to report back to us no later than June 30th, 2017, with analysis on the recommendations, and whatever you'd like to provide, it's your purview, as well as on related questions from council. So, yeah, and I'm sure there'll be quite an interesting and robust debate there. I guess the one comment I would make, because it's pretty much a routine motion, I know many of you are already very active advocates out in the community, but I think the experience of working with this really underlines how much of this is in the province's hands and how important that advocacy is in the community. So I know you'll continue to be advocates, but you are now informed, empowered, and advocates with a mandate very similar to council's, right, to bring that knowledge to the community. So if I could ask you to do one more thing as a volunteer as post-task force, I hope that you'll continue to do that. Thank you.
Okay, thank you for that motion. Councillor Carr seconded. Any debate on the motion to receive the task force final report? With big thanks to the task force and requesting staff to report back by June 30th. And don't see any. Do we need to go to a formal vote? Okay, we will vote on screen. Council? Okay, we have a unanimous support for the motion. So that carries. Thank you again very much to the whole task force for all the work, and we'll look forward to next steps from our staff. Thanks for being here today, all of you, and we have concluded that report reference from the Independent Election Task Force, and we are on to our bylaws in the agenda. We have 11 bylaws on the agenda for consideration, and I'll ask if any members wish to hold any of the bylaws for debate, separate vote, or for conflict of interest. Let me clear the queue here. And going through some of the detail here, bylaws 2 and 5 through 10. 2 and 5 through 10 are public hearing enactment bylaws. And so council members who were absent from the respective hearings and have not previously advised they reviewed the proceedings may only vote if they now confirm that they reviewed the missed portions of the meetings, which includes viewing the related video clip. So on bylaw 2, that was a public hearing enactment bylaw from a hearing held on December the 15th, 2015. Councillor Jang, you weren't at that hearing. Have you reviewed the proceedings? Will you be voting on the bylaw?
Yes, I have reviewed the proceedings. We'll be voting on the bylaw.
Okay, thanks. Bylaws 5 and 7 are public hearing enactment bylaws from a hearing held December 13th, 2016. And Councillors Ball, Reimer, and Stevenson were absent from those items at public hearing. So I'll ask first Councillor Ball if you reviewed the proceedings, will you be voting on the enactments?
I have and I will.
Okay, that's yes and yes. And Councillor Reimer? Yes and yes. Councillor Stevenson?
Yes and yes.
Okay. And bylaw 6 is also related to the public hearing held December the 13th. Councillor Ball, you were absent from that hearing. Have you reviewed the proceedings? Will you be voting on the bylaw?
Yes,
number 6?
I have and I will. I did watch them as they were happening.
Okay. And bylaw 8 is the public hearing enactment from a hearing that was held January the 19th, 2016. And I was absent from that hearing. I will not be voting on that bylaw. So with, we've got bylaw 9 as well. That's from a hearing held September the 16th, 2014. Councillors Jang and Reimer were absent from that hearing. And Councillor DeGenova was not on council at that time. Councillor Jang, have you reviewed the proceedings and will you be voting?
Well, that was so long ago I forgot, so no.
Okay. Councillor Reimer? That's a yes and yes. And Councillor DeGenova, for the record?
I was not on council. I won't be voting. Thank you.
Okay. And bylaw 10 is from a hearing held June the 14th, 2016. Councillors Deal and Reimer were absent from that hearing. Councillor Deal, have you reviewed the proceedings? Will you be voting on the bylaw?
Yes and yes.
Okay. And Councillor Reimer?
Yep, and yes, and yes.
Okay. Good. All that is clarified. So I'll ask for someone to move bylaws, adoption of bylaws 1 to 11. Councillor Stevenson moves, Councillor Carr seconds, and all those in favor of adoption of the bylaws, all 11 of them. Any opposed? That carries unanimously, and the list of the approved bylaws is available on the city's website. So we're on to administrative motions. We have 5 administrative motions which are to be moved by Councillor Reimer and seconded by Councillor Deal next door. Any discussion or debate on the 5 administrative motions? All those in favor? Any opposed? And those carry unanimously. So we are on to motions on notice, and the first is a request for leave of absence for Councillors Ball and Jang. Would someone like to move that? Councillor DeGenova? You need to amend this one? And, okay, let me just... You're wanting to, B1, you want to amend it?
Absence request, I'm happy to do it as a separate motion.
Yeah, we're in motions on notice.
Okay.
So the The motion on notice B1, and I have a mover and a seconder for that. Councillor Deal will move, and a seconder. Councillor Jang there first. All those in favor? Any opposed? And that carries. The second motion on notice is amendment to a roster of councillors to represent council. And we'll ask for a mover and a seconder on that front. Councillor Ball will move. Councillor DeGenova. And all those in favor of that motion? Any opposed? And that carries. And the third of our motions is the National Inquiry into Missing and Murdered Indigenous Women and Girls. And that motion does have speakers who wish to address council on that motion. So I will ask Councillor Reimer to move, assuming we want to hear from speakers, to move the Councillor Reimer is moving the motion, Councillor Carr is seconding. We need referral if we're going to hear from speakers on that.
I'm happy to refer it and introduce the motion tomorrow.
Okay. Councillor Reimer moves referral and a seconder, Councillor Carr. So all those in favor of referral to hear speakers tomorrow? Any opposed? And that carries. We will see that tomorrow and hear from speakers, and Councillor Reimer will introduce the motion at that point. Likewise, with the fourth motion on notice, we now do have a speaker, and that is the City of Vancouver-led Intergovernmental Task Force Combat Homelessness, to be moved by, that is moved by Councillor DeGenova, seconded by Councillor Ball, and we do have a speaker for that. So Councillor DeGenova.
I'd like to move referral to
Okay.
tomorrow's meeting.
To hear speakers and a seconder for that. Councillor Carr. So all those in favor of referring to tomorrow to hear speakers, and any opposed? That carries as well. And we're on to motion on notice number 5, which also has speakers as well. That is the inquiry and future planning for extreme cold weather and snow removal, to be moved by Councillor DeGenova, seconded by Councillor Affleck, and Councillor DeGenova.
To tomorrow's committee meeting.
Okay, move referral, seconder, Councillor Carr will do that. All those in favor of referral to hear speakers tomorrow on number 5, any opposed? That carries. So that goes over to tomorrow as well. And that means we're on to notice of motion, new business inquiries, and other matters. I have 2 leaves of absence that have been requested. The first is a leave of absence for civic business for Councillor Stevenson for April the 7th, April 11th. Okay, April 11th, 2017. And I need a mover and a seconder for that. Moved by Councillor Jang, a seconder. Councillor Deal, all those in favor? Any opposed? And that carries. And I have a request for leave of absence from Councillor Reimer for civic business for meetings the week of March the 6th, 2017. A mover and a seconder, Councillor Ball, and all those in favor? Any opposed? And that carries. And that means we'll go to the speaking queue. Any other notice of motion, new business inquiries, or other matters? Councillor Deal is first.
Yes, thank you very much. I just wanted to rise and briefly acknowledge the Women's March that happened this last weekend. It was a remarkable event organized very, very quickly by a very small group of volunteers who simply saw the need for this to happen. And they had not met each other before they started working together on this. Had the supreme honor of speaking at the event. I did not have a hat at the time, but one was given to me shortly afterwards. In fact, 2 were offered to me within moments of finishing speaking. But I really just wanted to thank the 15,000 people, that number has been confirmed at a minimum 15,000 by the VPD, who came from all over the region. People were coming up to me who had traveled some distance, actually. Not huge long distance, but as far as Squamish and Bellingham, for instance, to come to the march. They felt the need to feel good. And I think that was the overwhelming sense of the thing by the time people walked and met with each other and spoke with each other and talked about what we want to do next in this world to make it a world that continues to be one that we love living in, and what we can do here in Canada, that people felt hopeful and they had felt a need for hope. And so to the organizers, to everyone who's there, I know that Councillors Reimer and Stevenson were there. There may have been others as well. It was supremely moving. I certainly felt like personally I needed it. I needed that feeling that we were going to work together in a positive direction going forward. And that day gave me a real sense of hope for the future that had been feeling a little bit bereft in the last few weeks. So again, just thank you so much to everyone who showed up and to those organizers and to the sign makers and to the hat knitters and everybody else who was so creative and colorful and quite entertaining in some cases in their approach to making their voices heard and taking a pledge to take action moving forward.
Thanks, Councillor Deal. And Councillor Reimer's next.
Thank you, Mayor Robertson. A few things. Plastic Ocean. So we had the global premiere of a new movie called Plastic Ocean here, which looks at the impacts of plastic pollution in our oceans. Our staff in waste management have been very helpful to the producers of that. It's quite a significant and it's a well-acclaimed film, although I know it only premiered last week, and I would really encourage council to have a look at it. One of the experts that they work with is an individual from Vancouver, David, I'm forgetting his last name, how awful. He works with the Plastic Bank. Happy to get you more information on it. What he does is he actually reclaims, he pays people in the developing world to reclaim plastic and then uses it to create ethical plastic, social plastic of a kind, because it's a recycled plastic. There was some fantastic and innovative solutions there, as well as some pretty dark information about how important our work needs to be on zero waste, particularly when it comes to plastics. I also wanted to note a couple of events coming up, because we will not meet between then and now, and one may require some pre-planning on your part. In addition to the Lunar New Year celebration in the Chinese community and Vietnamese community, this is also an important time for coastal First Nations who observe Lunar New Year as their major New Year celebration. The Hobai, which is the big Nishka celebration, the public First Nation celebration that you can attend, is on February 3rd and 4th at the PNE, and I would really encourage people who are available to go. It is quite, it's a really amazing experience to celebrate Lunar New Year with the local First Nations and with the Nishka who are living here. The other thing related to the Women's March was interesting. We had a Women's Advisory Committee that week, and we're sort of, maybe fretting a bit. There's many women's marches that have happened over the course of the last many years, not as well attended, and sort of wondering where the attendance might go. And they had a slogan around making that Donald Trump and America are making feminism great again. And it was really fabulous to see so many people who may have previously had a challenge calling themselves a feminist suddenly right up there. So to that end, the longest standing women's march in the city of Vancouver is on February 14th, Valentine's Day. It's the Memorial March for missing and murdered Indigenous women and girls. It is a challenge to get there during the week, I know, for some, but I think it would be quite incredible if we could see the spirit of the Women's March transfer over to women and girls in our society that really need your help to have their voices heard at a very critical time with the federal and provincial governments. Thank you.
All right, thanks, Councillor Reimer. Councillor Carr.
Yes, thanks, Mr. Mayor. I just have one item for in terms of notice of motion, and it rises out of the decision that was made last week by the provincial government to give the environmental approval to the Kinder Morgan pipeline. So you have, I think, on your desks my notice of motion, seconded by Councillor Reimer, to proceed. Thank you. Just to complete the title, thank you. Judicial review of provincial government decision to approve Kinder Morgan's pipeline expansion project. So we'll hear that in 2 weeks.
Okay, thank you for that notice of motion, which will come back in 2 weeks' time. And Councillor Ball is next.
Yes, thank you, Mr. Mayor. I wanted to particularly thank you for marking the loss of Joy Coghill to Vancouver. Joy was a mother to the theater community in Vancouver and indeed across the country. She was able to work with many of us at Holiday Theatre. Indeed, she was my first theater teacher and acting teacher. And Joy was somebody who never heard the word no. It didn't matter what it was about. If she was going to do something in our community that would benefit people, she found a way to do it. Every mountain was just, how do you get over it? And she did it. And it didn't matter when my phone rang, it would always be Joy calling, hey, I need $5,000 or this project isn't going to get off the ground. Can you find it? Can you get it? Because she knew that the direct ask was the way to get things done. And Joy, in her work at PAL, which all of us at the city have supported over the years, was incredibly important for our seniors and for those who've contributed, again, like Joy did. She lived many happy years in PAL and started all kinds of healthy programs. And I have to say that when we get somebody that remarkable, it's wonderful that she is acknowledged by the BC Entertainment Hall of Fame in cooperation with the city on Granville Street in the 800 block on the east side of Granville. So if you want to honor Joy and walk by and shine up that beautiful brass a little bit, you're always welcome to. But I want to celebrate that real spirit of innovation that Joy brought to the city and her wonderful generosity and the fact that she was willing to help us at the city in any way, shape, or form we needed. So she's a real gift to us, and I'm sorry to lose her. Thank you.
Thanks, Councillor Ball. Appreciate those words. Councillor Stevenson.
Thanks, Mr. Mayor. I just wanted to add a bit in my experience at the Women's March. There were indeed far more people than anybody ever anticipated. It was really a wonderful atmosphere, but I want to put it in the larger context because all over the world, around 5 million people marched in cities throughout North America and Europe and elsewhere, which is quite remarkable. I don't remember anything before having this kind of impact worldwide. So it was really significant for me because, of course, we have 3 daughters to be there. One of our daughters was there as well, and it's really was really important to her. It was also good to see some of the faith communities out because there are, particularly in the United States and unfortunately to a degree here, some very conservative Christian communities that are not in favor of the rights that have been achieved for women and are in fact advocating against this. So it was really important for me to see faith communities there as well joining in the march. And I also have to say that Councillor Deal did a remarkable job speaking at that rally. It was really an excellent speech, very significant. And I know a lot of people appreciate it because people have spoken to me about it. So thank you, Mr. Mayor.
Thank you, Councillor Stevenson. And that is all for our notice of motion, new business inquiries, and other matters for this first meeting of 2017. So we have concluded our agenda for today, and we need a motion to adjourn this council meeting. Councillor Stevenson moves, Councillor Jang seconds. Any debate? Last chance. All those in favor? Any opposed? That carries. So this council meeting is adjourned. And we will be back here this evening at 6 p.m. for a public hearing, the first public hearing of the year. Thanks all.